You have a 21-year-old child.
Yeah.
Yes.
Wow.
Yeah, exactly.
Yeah.
I was shocked when I read her request form.
Allahumma barik.
I was like,
Blood
what?
don't crack.
Fam.
Welcome to Entry Level Mums. We're back. I'm Nasra.
I'm Suia.
And today we're in a new studio. It's the same studio. They just got different chairs. It's a bit confusing for us, so I apologize if I look over there or over there. We have a wonderful guest.
Yes.
So we'll do the honors.
We have a wonderful guest that we met at an event recently.
Yeah.
And when she told us what she does, we were like, yeah, the audience needs a bit of this.
Yeah.
She's an amazing midwife. And she's here to talk about HG, like proper.
Yeah. Because we have talked about this quite a lot on this pod.
Yeah.
And we know that a lot of women suffer from it. Like a lot of women we know have suffered from it. So it's only right we actually speak to somebody who knows their shit.
Yeah.
So guys, without further ado, let's introduce Jemma.
Hi guys.
Welcome, Jemma.
Hi. Thank you for having me.
Thank you for coming.
Thank you for coming.
It was a pleasure to meet you, honestly.
Honestly, like the vibe was just there. The vibe was there instantly. So it's a pleasure to be here. So thank you for having me.
Jemma, how are you? How many kids you have? Like, because we were shocked when we read your request form. I'm not gonna lie. The age of your children, I was like, there ain't no way, because she looks like she's 25.
For real.
Yeah. So I definitely have 3 children. One is 21.
Wow.
My eldest is 21.
Allahu barik.
And then my son is 17. And then my youngest is 4 years old.
Wow. 17 and 4.
17 and 4.
That's
So
a
we
big
have
gap.
to talk about the gap, like,
That's a big gap.
because how was that like?
Do you know what? To be fair, basically what happened, COVID happened.
Yeah.
Is what happened. COVID happened. And I was saying to my women, you know, when you're at home with your partners, be careful because, you know, you can get pregnant and you're at home. And yeah, I didn't take my own advice. It's basically what happened there. Because I was away. I was free. Like I had the older 2. Like I'd passed the finish line. No more nursery fees, no more nappies, and then COVID. And yeah, that's how I got there. So I have a big gap. But I appreciate it because the first 2 I had in my 20s, my early 20s. And then obviously my last I had in my late 30s. And the experience was completely different. But it was so nice. It was a nice experience. It was different. Plus, and it was my last one. So I was like, yeah, we're going to jump in puddles. We're going to do things that we didn't do before. We're going to try and go to play groups or what have you, because we ain't going here again.
Aww.
We ain't going here again. This is the last one. So yeah, but it's been lovely. It's been nice. And it's been nice to have the older 2 involved as well.
Yeah, I was going to say, like, you've got older kids that can help you out as well.
Yeah, don't.
Go get the nappy, go to the shop and get me some wipes.
No.
They did.
Yeah, little bit. But they're, because they're at the ages now where they're doing them. So you've got your 21, 17. So they're finding their feet for themselves. So, but they are very hands-on. And I couldn't do without them. I appreciate them so much.
Oh,
That is so mad. Because, you know, COVID, I feel like it really reminded people about how much time and energy you actually spend at work.
Yeah, it
and
does,
all
honestly.
of a sudden, you're at home, you don't have to go anywhere, you don't have to do, like, anything except for just work from home. And now everyone has full energy, they're just themselves, you know?
Yeah,
You
honestly.
feel back 100% back to yourself.
Yeah, and it was quite intense as well because I think for me, I was pregnant and a midwife, and there's not much you can do as a midwife at home.
Wow.
yeah.
So it was like trying to navigate what can I actually do? How can I manage at home? And then it got to a point where I couldn't do anything because of my HG. Like I couldn't do anything. All I could do was turn from left to right.
Oh my God.
I couldn't. I tried to work from home, tried to do emails, tried to communicate with, you know, my clients over the phone. I was signed off for a long time.
Oh my goodness. So
I
did
was
you have
signed off.
HG with all 3 pregnancies?
I've had it with 3 pregnancies and 2 losses.
Oh.
So for every pregnancy that I've had, I've always had HG, always had it. Didn't even know what it was when I first got it, didn't get diagnosed. So my first experience with HG with my eldest, I was at home and I knew when I was pregnant straight away because, you know, as a woman, you just, something feels different.
You just know.
And took a test and I saw it and I was like, oh my gosh, I'm pregnant. Excited, ecstatic. And then I got to about 6 weeks and I was like, this nausea, and it really knocked me out. So I was like, I'm struggling here. Like, I'm really struggling here. So the nausea hit me like a ton of bricks. And then I think it was 6 weeks and 1 day, and that's when the vomiting started.
Oh my God.
And I was like, this is never pregnant. This is not the morning sickness that people talk about, because I hear people talk about it and function. They say, oh, I've got morning sickness, but they go to work or they go for maternity shoots and stuff like that. And I'm like,
they vomit in the morning and then they go about their day.
Yeah.
I used to think that too. Like, why is it called morning sickness? Is it just you just
in the
get a bit-
morning?
You wake up
in the morning and then
Exactly.
release, and then like, all done for the day.
Exactly. But I was like, no, something's wrong here. Like, I'm vomiting. I can't stop vomiting. I can't eat. I can't drink. I can't sleep because I'm waking up to vomit. Like, something's wrong. But because nobody told me this was not normal, I stayed at home for such a long time. So I think for maybe 4 weeks. 4 weeks I stayed at home. I was vomiting. First it was like 5 times a day. Then it went to 10 times a day.
Oh my God.
Then it was like 20, and I was like, this isn't normal.
Yeah.
But because nobody said it wasn't normal, I just went with it.
Mad.
So by the time I got to the hospital, I'd lost 2.5 stone. 2.5 stone, I think within 3.5 weeks, 2.5 stone. And I just got into the hospital. My mum was like, something is wrong. So my mum, my partner, took me to the hospital. I just collapsed on the floor. As soon as I got in there, I collapsed on the floor. I remember they came rushing over. I couldn't hear much. It was very drowned out. Like, I literally was just, my clothes were hanging off me. You could see my collarbone, everything. And the midwife in charge said to my mum, like, why did you leave her so long? And my mum was like, nobody said, like, no one says when to come in or what was wrong. And everyone was like doing checks on me, tried to get my veins, couldn't take blood because my veins were just shot to pieces. I was dehydrated. And I just remember my mum and partner sitting there watching. My partner just looked like he'd had the wind knocked out of him. And my mum was just in tears. She was just crying in tears, like feeling bad. And I was like, don't feel bad, Mum. Like, you didn't know. And it was a midwife that the doctor didn't know, didn't tell me what was going on, didn't diagnose me. And it was my mum that came over and was like, the midwife that came over, and she was like, you have HG. And that's what she said. She didn't explain it. She didn't say what it meant for my pregnancy, the risks associated, nothing. And I was like, okay, I have HG. And then I was like, well, what's HG? What does it stand for? I had to research myself. I literally had to research myself, find out what it meant, what it was to do with. And that's how I found out I had hyperemesis. After that, I stayed in hospital for 6 weeks. Wow. 6 weeks in hospital.
In the hospital for 6 weeks.
Because everything, my body just shut down. And I've only got one kidney as well. So my kidney was under so much pressure that started to malfunction. I literally couldn't eat. They couldn't get a drip in. Then they thought, and I think it's because nobody knew what was wrong. So it's almost like I was a guinea pig. So they did a brain scan. They did an experiment on me. Like, I couldn't drink for a whole 24 hours. And then they was checking my kidney. I had a lumbar puncture. Like, I had so many things because they didn't, that was my assumption. They didn't know. Because if you did know, maybe you would have known how to treat me. But because you didn't know, you just was testing and doing all these things.
Were you still vomiting?
Oh yeah,
that whole time,
for sure,
while they were doing all their tests.
For sure,
that's mad.
For sure, they gave me anti-sickness, and it's funny because you try to, if someone's vomiting, don't try and give me oral tablets. Don't try and give me something oral. Like, let's make it make sense. Then they gave me IV, but they struggled to give me the IV because my lines weren't. So like, take the oral until we try and get your lines in. I was like, it's not gonna work. And lo and behold, you just vomit it back out. You're
also dehydrated, so imagine trying to take blood or anything. IV is long.
Exactly. So,
that
but again, again, at the same time, no one's explaining to me what's happening. Then you've got, then I go and see this doctor, and he's like, you know, his idea of support was like, you're really unwell. You know, I'm suggesting you terminate the pregnancy and try again next year.
Right.
Because you're really sick. and you know you're only at the beginning of your pregnancy. So, and I was like,
I didn't know doctors could actually say that to you.
Are they
Like,
allowed to say that?
right, I didn't know they could say that. I thought it was just the woman's like choice to terminate.
but obviously it is. But
Yeah.
they can advise, and
Damn.
you know, and I was just like, is he for real? Like, is this man for real? Like, are you for real?
I would have been so offended.
I just came out
Bro.
of there, burst into tears crying, and went to my midwife. And I was like, I don't want to see him again. It's not going to work. If this is what I have to deal with for the next 9 months, I'm not going to cope. I'm not going to cope. So I saw my midwife. And I think at this point, I'd just been booked, just had my midwife, and she had just been assigned to me. And I will never forget this woman, because it was her why my child is here, why I have a 21-year-old. Because she was like, look, do you want this pregnancy? Do you want to go through with it? Whatever you want to do, I'm here for you. Whether you don't think you can manage, I'm here. If you feel you can manage, I'm here to hold your hand. And she literally held my hand the whole of my literally. She would come with me to my appointments. When I was in hospital, she visited me every single day. She was on shift. And the doctors would take me to go and scan the baby at night time, and nobody was there. Like, they were so amazing. And I was like, I want to be a midwife.
Oh.
Like, I want to be a midwife. If this is what it means to be a midwife, I want to do this. Because if someone comes to me and says, Jemma, I'm vomiting, I need help, I don't know what to do, I'll be like, right, I've got you. And this is what started my midwifery journey. This is where it started from, because I was actually doing a sports science degree.
Wow.
And I dropped it. I got to my 3rd year and I dropped it. I was so determined and excited to be a midwife. Common sense didn't say, well, okay, finish one first and go to the other. I was like, no, to hell with this. I'm going.
That was a calling now.
Yeah. I was like, let's do this. So I had my daughter and I was like, right, I'm going to apply. And they didn't take me the first time. And I think the question that put them off, and they said, oh, why do you want to be a midwife? I was like, because I want to change things for midwifery. I said, I want people to remember my name. I remember my point and why I'm here and my cause. And they were like, no, midwifery is more than that. It's about caring for women. I was like, I get that, but I'm going to make a change in midwifery. And she was like, I don't think it's for you. Just do some more research and come back next year and what have you.
So how's the process like to be a midwife? I mean, they interview
They
you like
changed
that.
it now. They changed
So-
it.
That's how they
They interview. So at the time, they do an interview, your experience, and go from there. Ask you questions, ask you what's current in midwifery, you answer those questions. But now I think they want you to have some sort of experience, carer's experience. So whether you've cared for a family member, or whether you've done voluntary work, or whether you're maybe maternity support or worked in a care home, something to show that you've got a care inside you, so to speak. And the thing is, even if you haven't, and for any, I would say any students coming in or wanted to be a midwife, when you go to your statement, put that you look after your siblings on a weekend. That's caring.
Yep.
Yeah.
You look after your mum, you look after your dad, you look after somebody, you know, you do childminding. That's caring. That shows that you've got that side and it's within you.
Yeah, they're looking for that nurturing side.
Yeah.
Yeah.
But midwifery is very much, it's a challenging field. It's as challenging as being like trying to get into be a doctor. It's not easy. It's tough. It's competitive.
Yeah.
So make sure you want to do it for the right reasons. Don't do it for money.
Don't work in the NHS period
Right.
for money.
You understand?
not
Like,
there. It's
don't
not
do
there.
it for money.
Yeah.
But if your heart is in it, and not because you like one born every minute, not because you like
Damn, I would
call
have
the
said that.
midwife. I mean, you can say that, but it's completely different. Ain't nobody eating cake and swinging on chairs.
Listen, I would have said,
And-
hey, I watched that one Born Every Minute show. Looks lit.
Work is like that, don't get me wrong, but that can't be your basis.
Yeah,
You know what I
I
mean? There's so much more to it in midwifery. Like, the women I see every day, even though some people may call it repetitive,
Yeah.
it's not for me. Like, I see different women every day. I've learned about cultures. I've learned about midwifery care in different countries. Supporting students. I love having students. I know some people don't like having students. They struggle with it, but I love having students because they can teach me as much as I can teach them. So it's the students. It's even like your admin team. Everyone in my team, like I have a team around me and they're so amazing and they're all completely different. They're young, they're older, you know, some have children, some don't, different life experiences. But I think with midwifery, you need to be rounded.
Yeah.
You definitely need to be rounded within the field.
And there's something beautiful about being there for a woman in her most vulnerable moment.
Yeah.
And we hear horror stories about midwives who are just rude, condescending. And I'm just like, but why? This woman's in pain. Like, leave your attitude at the door. Do you know what I mean? Whatever it is that you're going through outside of this hospital, leave it outside. Because
if you had beef with your husband, leave it outside.
Like, some people bring all of their problems to work.
Everything.
And then they project it onto the patients. It's actually mad.
And you can't do that. You can't do that in this profession because it's a caring profession and you don't know what someone's going through.
It's true.
And for me, I always bring it back to hyperemesis as well, because if someone's late for their appointment, my thing is, are you okay? That's always my first standpoint. Are you okay? What's happening? You know, why are you late? Because I can't stop vomiting. I haven't been able to get out the door. And my response would be, stay at home, I'll come to you.
Oh.
But not everybody's like that, and not everybody gets it. And I wouldn't like to say, oh, you know, you have to go through midwifery or you have to go through hyperemesis to understand. But there should be an element that says, let's try and do the best we can for this person, for this individual. Because I'm telling you, to leave your house with hyperemesis, it's a big deal.
Are you crazy?
Like it's
not a joke.
Big deal.
Yeah.
The bus or the car, the smells, the movement, the trigger.
Anything can set you off.
So for me, in my room when I'm in my clinic, you got everything around, and I always have bowls, because if you need that bowl, it's there for you, and you don't need to feel bad.
It's quite embarrassing as well. Imagine
just about
would
to
you want to vomit in public? Like,
exactly.
No one wants to be doing that
on the bus, you know.
On a bus, public transport.
And that was me as well with my first pregnancy. I vomited on the bus coming back from my appointment, and I got my partner to meet me, and I said, I need you to come. Like, I need you to come. I can't stop vomiting. I remember I was at the top by myself, vomiting my life away. And when the bus stopped, me and the vomit ran down the stairs.
Oh my!
I was like, this is embarrassing. I can't do this. And I said to him, I'm not leaving the house anymore. I'm not leaving the house. This is too much. It's too embarrassing. And people, if they don't see you're pregnant as well, they assume you're drunk or something's wrong with you. And they don't really say, are you okay? They just like, ugh. That's embarrassing.
Very.
So I just was like, I'm not leaving the house. So my mental health took a complete hit. A complete hit. I was down. I tell you how bad my mental health was. I couldn't bear the smell of water.
Water?
Yeah.
What is water? What does water
It does
smell
have
like?
a smell, you know, especially in London.
Smell like?
It smells
water
like chlorine.
has a smell.
Yeah.
I don't know what it smelled like, but water had a smell.
No way.
And a taste. But the smell of water, I was like, so how am I going to bath every day? Me.
Wait, you mean tap water or do you mean bottled?
Tap water.
Tap water has a smell. Do you know?
Yeah, tap water. Yeah, okay. I was thinking generally like
yeah,
water.
because I was
Does it
thinking
smell
Tap
Highland
water.
Spring
Tap
don't smell
water.
bad.
I hear
No, it
Sponsor
does.
us.
It does.
Sponsor us.
It does.
That one don't smell bad at all.
Tap water has a smell. Buxton's, Evian,
Nah, Volvic, It's
But
either
they all-
Highland Spring or Voss. Sponsor us.
Is
They
it?
all-
Rah. If you told me
They
to
all
tell me the
have-
difference between
yeah.
them, I wouldn't be able to tell you.
Saka's not bad as well.
Saka's good.
Yeah,
Saka's
not bad.
good.
It's alkaline water, isn't it?
Saka's good.
Yeah, Saka's
But
not
yeah,
bad.
and smart water is good because it's got electrolytes in it.
Electrolytes, yeah.
I'm not a fan of
It
Saka.
also doesn't have a smell.
Yeah.
I'm not a
Yeah.
fan of Saka, you know.
You're
Oh,
not
you
a fan
know?
of Saka?
I like
It's an alkaline.
Volvic. I like Volvic.
You like the nasty one.
And I like Highland Springs as well.
No.
Volvic is nasty.
No.
I don't like
No
that one.
way.
I feel like it has a weird taste.
Yeah.
That's mad.
But yeah, I struck when I used to tell people this, they looked at, you know, like just how
They
you
look
guys
at you like you're mad, yeah.
Natural reaction is like, is she okay?
No, but I hear it
Yeah.
because I'm also one of the people that know the difference between waters. Like, if you don't drink water, you're not going to know the
wouldn't
difference
get it.
between it. Do you know what I mean?
Yeah.
Some of you lot have battery acid insides, bruv. Some of you lot got battery acid on the inside, bruv.
But yeah, I struggled like bathing, and I'm someone I bath every day, like, and I couldn't bath. And then my own body smell used to get to me, so I was like, I want to strip myself of my own skin. Like, hyperemesis sends you, it like really sends you. And for me, you have to get it. And even if you haven't been through hyperemesis, understand when a woman walks through your door and she says, I've got HG, or she's on the phone in tears, like, take it seriously.
Compassion,
Take it
innit?
real seriously, because that could be the difference between her continuing with her pregnancy and not continuing, because she just cannot manage. She can't cope.
I have a question.
Mm-hmm.
You know, when you said that the doctor said to you,
Mm-hmm.
I recommend that you terminate this pregnancy and try again another time. Throughout that 9 months that you were pregnant, did that keep ringing in your ears?
Yeah.
He just, like, his words, right?
Yeah.
It was ringing in your ears, thinking, am I doing the right thing?
Yeah.
That's so sad.
Yeah. Because you have the guilt of, what am I putting my baby through right now? Is my baby coping? Because I'm not coping. So how is this baby coping?
Right.
And then you have people saying, oh, you know, if you're vomiting, it means it's healthy pregnancy. And you go along with that because that's the old wives' tale that you've been told. But then really think about it. If I'm not coping and I'm losing all these nutrients and I can't manage to eat, drink or anything, how is that good for this baby? So am I doing the right thing? Am I putting this baby through all of this for nothing? And you hear whispers of, you know, you're at a high chance of miscarrying and, you know, all of these things and having a smaller baby. And you're like, am I doing the right thing? So yeah, that definitely rang through the whole 9 months.
That's
The
horrible.
whole 9 months. And then my relationship with food was just like I'm a foodie.
Did it change forever, or was it like for a certain amount of time?
Throughout my pregnancy, my relationship with food was poor. And then afterwards as well, because you still, for some women, they still have sort of the food aversions, the hypersalivation, which is what I had. Did not know anything about that until I became a midwife and trained. And hypersalivation is one of the things associated with hyperemesis. So you know that spitting you see when we bottles, spitting.
That's how we knew my aunt was pregnant. Every time she was pregnant, you know, you just see, as soon as you see the Evian bottle and she's doing this, we're like, another one's coming.
Yeah.
100%. There's another one coming. She clocked as well. As soon as the you know, your
the
spit
nausea
glands
and the
and
the
nausea,
saliva,
That's mad.
yeah. And I didn't know that.
That's
It's called
crazy.
hypersalivation. It's also called botulism, and women don't know this. And for me, as a midwife, like, we should be just educating ourselves to the point where someone comes, they've got hyperemesis, and they say to you, I've got HG, or I think, or they give you symptoms. I'm not eating, I'm not drinking, I'm losing weight, I'm vomiting, the nausea is horrendous, I can't cope, I can't look after my house, I can't go to work, I can't look after my children.
I can't sleep.
You've got HG.
Wow.
It's debilitating.
Before 16 weeks, mind you. It has to be before 16 weeks. If it's after, it's like to be something else. It has to be early on. So before 16 weeks for it to be hyperemesis. Yeah.
So even when you're sleeping, you wake up to vomit.
Listen, I never forget 3
Oi.
o'clock in the morning. And I think I was dreaming about food. And these are the things as well, because
Oh, you triggered yourself.
yeah, I was dreaming about food, like, oh, I'm going to eat this and I'm going to eat that. My brain said, or belly said, or someone said, my big toe said, absolutely not.
No.
And I just woke up and I was like, ugh. Ran to the bathroom. I was like, yeah, this is not for me.
Do you know what's insane? Like, you're not eating, right? So you don't even have food in your stomach. Where does this vomiting, like,
It's bile,
what's
isn't
coming
it?
Yeah.
out?
It's like
It's
the
bile and the retching. Yeah, and that's awful.
the
And then
retching is
it's the like, and you know what people don't speak about? For me, for hyperemesis, it's the pelvic floor issues as well. Like, remember, when you're vomiting and when you're heaving and you're putting a strain on your pelvic floors and your stomach, it affects it. And because you're pregnant as well, your body's in a state of relaxation from being pregnant. So you're vomiting, your pelvic, your bladder is shot to pieces. Like, remember, you're putting that pressure there. And this is some of the things that women don't speak about. Midwives, doctors don't speak about.
And then it gives you incontinence later.
There you go.
Or from the
There
from
you go.
then, isn't it?
Yeah.
That's so sad.
So these are the things that I'm just like, let's talk about this. It's fine. We need to talk about this because you need to know how to look after yourself or prepare for that pregnancy. You know, pre-pregnancy planning is so important when you've had a hyperemesis pregnancy, because you're even at a higher risk, over 50%, 75 to 8%, you're at risk of having another hyperemesis pregnancy. So you need to know how to prepare if you choose to. And there's going to be there's women that are like, I'm not doing this again. I'm not putting myself through this because of the experience.
Did you guys hear about that woman that took her own life?
Yeah,
Sorry,
Jess.
trigger warning.
Yeah.
But I saw an article of a young mum who had debilitating HG and she ended up taking her life.
Yeah, her
So
name was
sad.
Jess and her baby's name was Elsie. Yeah. And that's because education for me. It's the education of the midwife, the doctor who she spoke to, not understanding what she was going through. Like, it was affecting her mental health. She couldn't move. All she could do was voice note. You know, her family watched her deteriorate. And I think it was the midwife spoke to the doctor, and the doctor said, tell her to come off of her anti-sickness. So she did, because, you know, you listen to doctors, you listen to midwives, and it just yeah, spiraled. And
That's so sad.
yeah, she lost her life, her baby lost their life. And that's a family without a mother, a daughter, a granddaughter, a partner, and all because the communication and the education. And my thing is, we don't start educating people once they get into the profession. We need to do it at university. We need to do it if you're going into an access course or what have you. Wherever people are learning to be in that field, that's where we need to start from. There's no point trying to teach someone something once you're already qualified. It should be a part of the syllabus, because it has such a knock-on effect.
Yeah.
You know,
It
you can
relates
have
to mental health as
yeah,
well, man. It's
the
crazy.
mental health aspect. I'm so glad the new guidelines from last year, the RCOG guidelines, updated and highlighted the importance of mental health support. Mental health support. You're not depressed and have anxiety going into it. You're depressed and have anxiety because of your HG. You know, so you need that support. But there's no point going to someone to support you with your mental health if they're not trained in hyperemesis.
Exactly.
They're just going to sit there like, have you done a food diary? What kind of food? No, please don't. It's patronizing, and you're not helping my situation.
Also, it's very easy to like get confused with like the health professionals, where they're like, oh, you're depressed. Is it because you don't want the kid? And now you've put that thought in someone's brain when really they just don't want to vomit.
Yeah, I don't want to vomit. I want to be able to eat. I want to be able to swallow.
Live
I want
my
to be
life,
able
you
to.
know?
You understand?
Goodness me, yeah.
And then there's the medication aspect, the anti-sickness.
Damn.
The first thing someone will say is, oh yeah, here, they'll say, this is what will happen. Majority of cases. Here's the medication, but you're going to make your baby deformed.
Do you know
Here's
did
the
that?
medication.
They did that to
Yeah,
Zaynab.
you understand? Here's the
Yeah.
medication, but oh my gosh, the risk to your baby. And who's going to say, oh yeah, let me take the risk to my baby? Who's
Do you
going to
know
do that?
Our friend recently had a kid, and they literally said the same thing to her. She had HG as well, and we would literally just be sitting, and she'd be like, I need to vomit, and then she would just get the bucket, and I would just be rubbing her back,
Yeah.
and she's in mid vomit. She goes, I'm so sorry, and I'm like, don't say sorry, and I'm like, just get it out, right? And she's
And it was
like,
violent. Like
it was
violent.
violent.
Every time she vomited,
violent.
it took so much out of her.
Yeah.
Like, it was
It's
just
tiring.
She would just be so
Oh
sad
my
and cry
God.
after.
Yeah.
And I'm like, I'm so I don't know how to comfort you. And just give her hugs and be like, I'm so sorry. But they said to her, if you take this medication, there's a high chance that your child will come out with a cleft lip.
That's
I
That's
think
what
it's
Dan's
called a cleft lip, right?
Yeah.
Or that your child will come out deformed.
The percentage.
She was so scared to take it. I remember.
Exactly. But then what professionals need to do is say, yes, there are some risks associated, but, you know, I think they will outweigh what you're experiencing and what you're going through. Because at that point where you don't know what to do with yourself, your pregnancy is at risk, you need help. You need help. And a lot of women that experience HG or nausea and vomiting need support with anti-sickness. And sometimes it's more likely than 2 or more anti-sick. I was on 4.
Wow.
And at that point, I was like, just give me whatever's going to allow me to take a sip of water or eat a sandwich. And for me, I used to cut a sandwich into 4, as you do. That sandwich would last me the whole day.
Oh my God.
I would just keep nibbling at it because that's all I could do to keep the food down. Hence why I lost so much weight.
What's the percentage of children that could get the cleft lip or the deformity?
Do you know, it's a really small percentage. I don't know I do know it, but now you're asking me, I don't know off my head. But it's small in comparison to what the outcome of having HG and no anti-sickness would be. Do you understand? It's so small. But again, with cleft lip, that can be treated. Like your baby can have an operation to, you know, close the cleft palate. You know, it's not, I don't know, I might be, but it's not the end of the world in that sense, in terms of that can be helped. You can have operation. It is that is done. But the highest risk for the baby is that you have a termination. You know, that's the biggest risk for a unborn child. The biggest risk for mum is her mental health and her health and her physical health and her well-being. So you've got to outweigh the risk. And for a lot of medications, doctors won't say, here's your heart tablets or here's your heart condition medication. Here are the risks. They give it to you. Sometimes some of these medications aren't even licensed.
So what is
Here's
it
medication for your diabetes.
Yeah.
They don't tell you the risks.
With, what is it
So why are
with
they trying to
pregnancy?
deter
But with
mothers?
What is it
pregnancy,
with it?
they're
Why are
saying
they scared?
here-
Fear mongering.
But also, as healthcare professionals, the most important person and the person that you need to take care of first is the mother.
Mhm.
The child isn't recognized as such till they're born.
Yeah.
So if your duty is to look after mum first, why are we scaremongering? Why are we not looking after the mother primarily and then secondary the child, the unborn child? And that's my issue. That's my issue. Look after this woman. Ask her what her options are. And some women will choose to go down the termination route. And that is okay. We're not going to sit here and say, oh my gosh, you're so bad. Why? Put your baby first. We're not, because you're not in that
But not
person's
everyone
shoes.
can hack it. Yeah.
You haven't been through it, man.
You haven't been
Yeah,
through it, and you
Sounds
don't know.
mad, and I've never been through it.
Right. And you don't know what it is until you've been in that person's shoes.
Yeah.
So if someone has said that to you, greet them with open arms and
Of
just say,
course,
I'm here for you. And that's why my midwife was so amazing, because she was like, whatever route you want to take, I'm here. She was non-judgmental in every form,
That's so
sense
beautiful.
of the word. And she's not here anymore. And I'm so, she passed away.
Oh,
That's so sad.
And one year I went to see her to take my daughter to say, like, look at my daughter. And they was like, oh, she passed away. And I was like, I was so heartbroken. Because I was like, you were absolutely amazing. And I just hope throughout her profession, someone let her know how amazing she was, because I seriously couldn't have done without her.
that's so sad.
Seriously.
You know,
It was the biggest shock.
And she was the reason you were
Went into
inspired.
midwifery, yeah. Yeah.
can I just say, you said that when you went for the first interview, you told them that you wanted to be remembered. We actually had a DM. Someone sent us a DM with your account and was like, can you get her on?
Oh,
Because she
wow.
was my midwife
Yeah.
and
Oh,
she was
wow.
absolutely incredible.
Yeah.
So people do remember you.
Oh,
we actually, and I
Someone
sent her a
literally name-dropped
message.
you
Yeah,
and
they
said she
named
was
dropped
my
you.
midwife. Yeah.
And then I was
Oh,
like, actually,
wow.
we actually met her. that's the when I did the
Yeah.
poll on Twitter, on Instagram,
Oh, wow.
and I was like,
Yes,
yeah, we
yes.
actually met her the other
Yeah.
day, and she fully name dropped you. She was like the best midwife I've ever had.
Oh, that's so nice. And for me, I've always said, when you don't know sometimes what your calling is in life, and you're just like, what's my calling? And I'm God-fearing, faith is a big thing for me. And it just, one day the penny just dropped. I was like, oh my gosh, like, this is my calling. Like, God, so you create life and I deliver it. I was like, hey, my G, literally, like, we're doing this together. So ever since then, I was just like, I'll put everything into midwifery. And yes, it comes with politics and all the rest of it and the NHS. But for me, I love being a midwife. Like, that is my thing. Couldn't see myself anywhere else. Couldn't do office work. Couldn't put on high heels. Couldn't do, being on the trains or this, that, and the other. Midwifery. Like, and a community midwife is that. Like, I love home births. It's my thing.
Have you seen that thing recently? There was a post that I saw on Instagram. I don't know if you saw it, Soya. I liked it. Basically, there's a lady who had a free birth at home, and then she's somewhere up north, and I would say the name, but I completely don't remember. But she had a free birth up north, and the midwife came and saw the baby, and then said, "Oh, by the way, black couple." She was like, "Oh, your baby's jaundiced, and you need to take your baby to the hospital." So her and her husband were like, no problem. They took the baby, they put it under blue light, and the baby was fine. And then as they were going home with their baby, police just stopped them in the middle of the car park and was like, have you got a baby with you? We need to arrest you, basically, because something about child endangerment, because you had a free birth at home.
I haven't seen that, but
I will find it and send it to you.
There have been a number of cases that sound similar to that. Some of them I'm just like, no. And some of them there's like backstories to it. But I haven't seen that one. But there are some things like that. Women are free birthing more and more because they're scared to go into the hospitals. They're not feeling supported by the NHS. They're not feeling supported by midwives, be it doctors. They don't feel safe. And childbirth and pregnancy is such a field and an area you have to feel safe. You have to feel like whoever's looking after you and caring for you has you. Like, you need to feel like you're at the center. And if you're not making your client feel like they're at the center, it's a problem for me. If you come into my room and by the time we finished our appointment, you don't feel like I've got you, literally, you're at the center and I'm listening to you and I'm doing what's best for you whilst keeping you and your baby safe, there's a problem. That's just my
100%.
that's my point of view, honestly, because you won't get on with everyone and that's absolutely fine.
Yeah.
But my thing is, if you don't get on with your midwife, ask for another one. You can do that.
See, they don't tell us
And they
these
don't tell
things.
you this.
Yeah.
You can ask for, it's like asking for a second opinion. If you're not happy with something, ask for a second opinion, ask for another midwife, ask for another doctor. You're within your right to do so.
There's a lot of, like, in the health industry, there's a lot of people who don't even know that if they're not happy with their GP, they can just change their
Yeah,
GP.
Exactly.
There's a lot of people who think that, like, depending
have
on
to
where
stick
you
with
live,
it.
you have to stick to this one.
Yeah.
I've been GP hopping.
Really?
I've been hopping around GP. I've been to like 7 GPs, bro.
I was on the same GP for like
Listen.
25 years, you know.
Swear.
But that's because the doctor was
Good, isn't it? Yeah.
Zaji,
Yeah, I
come
know
on,
what you
man.
mean.
until he moved to Cuba.
Wow.
Sorry
Yeah,
about
I've
that
been
one.
GP hopping. They don't
I
tell you that you
blame
can do that.
Yeah, and these are the things, like, come on, let's be inspiring. Let's tell women that they've got these options. Options are out there. And again, as a black woman, with black women in healthcare alone, and just, pregnancy and the stats that are out there, we
Yeah.
need to be informed. Women need to know what their rights are.
Facts.
Like, you've got information out there, but where do you get it from? So you should be, signposting and giving women this information and families this information so they can make choices. Like, you can make choices.
And that's where we met you, isn't it?
Yeah.
At 5 times more.
Yeah.
Yeah.
You've got choices. You've got options. It's not just one cap fits all. And we know that. We know that, one cap does not fit all. So that goes the same for pregnancy, for childbirth. Me as a midwife, my role is to make sure that you are well informed, you have all the information, and I'm putting you at the center. And it's just, I need to make sure that at the end of your pregnancy and your delivery, you're safe and your baby are safe. And you've had all the information. You don't have to agree with everything I tell you or the information I give you, but I need you to have it so you can make the decision and then say to me, what should I do? And I'll say, well, with this history and with this information, this would be safe for you and the best for you, what have you. And always ask your questions.
It's really hard when you're having a baby for the first time.
Very
because
hard.
you think everything these doctors and nurses and midwives are saying to you is the truth, and you have to follow it.
Yeah.
Do you know what I mean?
And the thing is, you just need to ask questions.
Yeah.
But then someone might argue, well, how do I know to ask that question? And it's correct. How do I know how to ask the question? How do I know what's available? And for me, I would say get your pen and paper or get your phone out and record your appointment. Say you're recording it. Let the professional know that you record. I'd like to record it so I can speak to my partner with it or whoever, and ask your questions, because sometimes you go for appointment and like that first booking appointment, it's an hour or so.
Yeah, the assessment, innit? The long assessment they do.
That's mind blowing. It's mind blowing for the midwife, even though she does it every single day probably. It's a lot of information to give. It's a lot of information to take in. So you need to go back and just let it sink in. How do you have good iron? Do you exercise throughout pregnancy? Can you have sex in pregnancy? All these things that before you go, you remember. And then when you sit there, your pregnancy brain is just like, So just, I would say write everything down, document everything.
Do you know, I think for me, one of the main reasons why I didn't do that and I didn't ask a lot of questions is because sometimes when you ask loads of questions, they start to act like you're a nuisance. Do you know what I mean? Almost like, oh my God, this one is going to be trouble
I don't want to be
because
too difficult.
she's asking too many questions or she's going to feel like she's going to be difficult, And as black women, it's so easy for someone to assume that of you. Like, even if you're just curious, like I have to now that I'm diagnosed ADHD, I have to explain to people if I ask you loads of questions, especially like professionals or like police or anyone that I speak to, it's not because I want to be difficult. It's genuinely because I need to understand.
Exactly.
And I feel like now we're quite lucky because with neurodivergence being more out in the open, they're less likely to think that you're just trying to, find shortcuts or that you're trying to be difficult.
Yeah.
But before, I didn't know that I could do that, and I didn't feel comfortable
doing
it. And I felt like they would think I'm a nuisance. My whole life, people have assumed that I was trying to be difficult because I need to understand,
And that's really sad, because even away from, because what about the person that doesn't have ADHD but wants to ask questions and feels like I need to ask questions to understand?
Yeah.
They should be able to do that without being judged. And I totally hear what you say, because I know there are some women that are like, even when they're in labour and they're like, they call up and they're fully in labour and we're like, why didn't you come in? Oh, I didn't want to be a nuisance. No, part of a midwife's role is to be a nuisance to her. That's what we're here for. That's what I'm here for. Ask me the questions. Ask as many questions as you want, because one of those questions, again, might save you and your baby's life.
Yeah.
It's that simple and it's that deep. Like, those questions may save your life. So ask away. Don't feel like you cannot ask the questions. Like, it's so important that you ask the questions you need. Like,
also, there's no TMI in it. You can if there's a problem,
listen,
somewhere where you don't know, want to say something and you're a little bit like, it's too much information, say
the
it.
questions that you can ask me go from A to 0.
Listen,
You hear that? A to 0.
There's no TMI with pregnancy and
Listen,
birth, man. Your legs are gonna be wide open on the day you get
Bust it
birth,
wide
man.
open for the
Like,
whole of the medical
it's
staff.
gonna be hella invasive.
Listen, ask
So you might
away.
as well ask the question.
It's so funny because I was talking to my niece at the weekend and she was like, Auntie Jem, and I was like, go for it. And she's like, is it true women poo when they're having a baby? And I was like, yeah, but you'd never know. I said, if you have a labour with me, you will never know. And you might ask me and I say, no, why? I don't need to embarrass you. I don't need to tell you that. But if you do that, it means you're on the right track.
Wow.
Because you're pushing in the right direction.
Exactly.
So yeah,
You're
ask.
pushing with all your might, of course.
With all your
a little
might,
poop is gonna come out,
from
man.
the head to the toenail. You're
Mate.
pushing with everything.
Damn.
Yeah.
So the body is amazing, and I'm the biggest biology geek. Like, biology is my thing.
Do you know
I
what's
love
mad,
that.
guys? I've never actually spoken about this on the pod yet, but I'm a C-section mom, innit? I've had 2 C-sections.
Okay.
And while I was pregnant, I was very anxious at the thought of having my legs open and doctors and nurses looking.
Everyone
and
there.
I was just like,
Your
no,
pussy being
that
on
can't-
show.
That can't be me.
Skin out your pum pum.
And I put like, because I've always been a very private, like, even when I'm getting changed in front of people,
Oh,
like, even if it's
swear.
women, like, even in front of my mum and my sister, I'd be all shy and that.
No
It's
way.
mad. So I've always been very shy when it comes
Yeah.
to, like, getting changed and stuff like that.
Yeah.
So I was like, no, there ain't no way I'm going to be in this hospital pushing and everyone's looking at me. Ain't no way. And then I ended up having an emergency C-section. And I feel like, did I jinx myself?
Did you? It's like your subconscious saying like, she
Because-
said no.
Because low-key, it was so weird. Because low-key, while I was in labour and they were wheeling me to the theatre, I was like, oh, thank God I'm not going to have my labour.
You pull it out there. You pull it out there,
Did
girl.
I really manifest that shit?
You did. You
God
put it out there. You
damn.
was like,
I never actually spoke
So
about it,
weird.
but I always had this thought in my head where I'm like, no, this is so invasive. What they doing looking at me like that? Like,
And this is the thing for some women as well.
it's
They're like,
mad.
so I'm just gonna be on show for everybody. I've seen
Right.
it in the, in the movies. You're just in the V shape, in the V position, and everyone's looking at your V. Like,
what
really?
I'm
No, some women are just like, and some women will opt for a C-section.
Mad.
And I remember I did actually speak to my mum about it, and my mum was like, trust me, Suya, when you are going through the contractions, you're not going to give a shit.
Yeah, it's
That's
true.
what she said to me.
You're not.
And that made me feel a little bit better.
Yeah, you're not. Listen,
So how many pussies have they seen, bruv? Yours is not special. The
I'm just
fuck?
about to say, like,
They see 20 pussies a day, bro.
You can say that to me
Come
all
on.
you want, but
it
they're
doesn't
still
ma- it
looking at
doesn't-
mine.
Yeah,
They're still,
exactly.
like,
I will never forget when I was a student, and I remember I used to see my some of my mentors would be like, push, 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 and they've got like their tea or their coffee in their hand, and they're like, you're doing so well, and I'm like, like, what? You got your
Oh,
tea,
for real?
coffee in your hand, like, oh, this is disgusting. Like,
oh.
years later, push, push, push. That's me. It's me can say to a woman like, you've got this, you can do this. Drinking my water, having a sip, putting it down, and I just like.
Desensitized, innit?
Yeah, because you're just like, you're so focused on supporting this woman and making sure she's safe and everything that goes with it, making sure her partner in the corner is safe and he doesn't collapse, that, I swear, I
You
don't
care
know.
about him.
These men are so dramatic.
Listen, I have to care about the whole family. Because when you go home is,
Man,
the
you ain't
partner
doing the hard
that's
work.
going to look after the whole family. So I've got to
That's
look
true,
after my
that's
dads.
true,
Like, I'm
that's
so
true.
passionate about dads. I'm
They're so dramatic.
passionate.
Oh my God.
Listen,
I've got an uncle who collapsed. He's had
I was
5 kids.
just about to say,
5 kids. Like, you would think after the first one he'd get used to
no,
it.
no.
5 kids down, he still goes, boop,
Yeah.
right there, right next to
Yes.
the bed every single time.
I'm
He
like,
collapses.
dads, If you can do anything, 2 things you don't do. You don't go to the bottom of the bed or the bottom of the body. You just keep yourself up there and you don't hold your missus' hands. And if you do, you squeeze with her.
Yeah.
Because if you let her squeeze your hands and
break
you
your
don't
hands.
squeeze back your fingers, just say bye.
Yeah.
It's just simple. But the dads are like, yeah, I'm fine. I want to see it. I'm going to video it. I'm going to take pictures. They go down there. Boodum. Then you're pressing the emergency buzzer because dad's on the floor. Everyone comes running in.
Yeah.
What's happening? I'm like, dad's on the floor. Can't move. Baby's coming out. It's a real thing.
That's
Yeah, it happens,
crazy.
man.
I think
actually know someone.
within my first year of being a midwife, qualifying, I got a picture back and it was dad with a bandage on his head and mum and baby, you know, cradling in the whole picture. It was so cute. But I was like, he's like, Jemma, you told me, didn't you? I said, I did. And you didn't listen. But it's okay. You got if you go again, you got another chance. Yeah, bandage. Yeah, he
Bandaged
hit
up.
the floor like a sack of potatoes.
I'd be like, hey, you're not trying to steal my thunder with you and your bandage.
Why are you so dramatic?
Why bear dramatic?
Mum didn't
Who
even
told you
acknowledge
to
him. She
faint?
was just like, I'm not even acknowledging you. I'm just pushing.
Because are you
Yeah.
going to worry about the baby? Or are you going to worry about your man? I don't understand.
He was like, I'm fine. I was like, yeah, you're going to be fine. You're going to stay down there until someone comes in because I'm busy right now. We're busy. Me and your missus are busy. We're doing something. Someone's coming. Yeah. It's a real thing.
Oh, that's funny.
If my man
That's
collapsed,
so funny.
on our first kid, second time round, you're not coming in.
You're not in the room.
You're not in the room.
No
You're not
way.
capable, my friend.
Yeah. Some men are like, well,
You've shown
that's
your
why years ago men used to stay outside. I said, probably. I said, you guys think you're strong, innit?
So dramatic.
You
not
guys
strong.
think you're so strong,
strong.
but you see when it comes to the punch.
You know,
You know.
nobody that was in my room wanted to look. Like, I had his mum and him in the room.
Mm-hmm.
I had him by the collar over here, and I was strangling him because he wouldn't give me his hand. So I was strangling him here.
I don't blame
He
him.
was literally like this, and then his mum was in the corner of the room on the other side like this.
Oh,
And my mum was like, I need to see what's going on. And she, the whole time, she was like this.
My mum said no. My mum said absolutely not. She said no, thank you. I don't want any part of this. Mum kept
Wow.
going in and out, but she was like, oh.
Mine watched every
My mum's
millisecond.
squeamish, and that's why my family are like, you're the odd one because nobody likes blood, nobody likes all of these guts and thing. Like my thing when back in the day was Casualty, Holby City, all of them shows. Like I was just like engrossed.
Oh,
ER, all
Grey's
of them.
Anatomy.
Wow.
Oof.
Listen, do you
Love
know
it.
Pulse right now?
Pulse, is it good?
on Netflix.
Yeah.
Oh my god.
Is it good?
Yeah.
Okay, I'm excited.
Yeah.
Watch it.
Ooh,
I'm waiting for Love is Blind
I'm addicted.
reunion. It's taking long time, bro. They're taking a long time.
I'm addicted right now. Any kind of show like that. And when I was younger, I used to, when my mum used to clean the chicken and stuff, I used to take it out the bin and like get needle and thread and start to sew it up.
Swear down.
Like, yeah. My mum was like,
I don't touch
what's
meat,
that
you know.
smell?
I don't
did.
like touching
I
meat.
was up in it all.
But you know when you were
Oh
at
my
school and you were
God.
doing the dissecting of the animals? I'm there. I would dissect all the animals. Just
No
don't let
way.
me touch no meat. I'm not touching no meat.
Really?
I don't know what it is. I don't like the smell. I don't like the texture.
I hate it.
I don't like how it looks. Don't take me to a butcher. My
No
my
way.
ex-mother-in-law took me to a butcher when I was pregnant, and I literally got like this far away from it, and I was like,
Oh no.
the whole time.
I love taking
I said,
blood.
"Don't take me there."
I don't like
Putting
touching,
cannulas in.
chicken.
oh, see, I wouldn't mind doing that if I did like all of that.
Yeah.
My mum loves that. My mum does. She does phlebotomy.
Phlebotomy, yeah.
Yeah, she
that
likes
was
that
the first
stuff as
thing
well.
I learned before going to midwifery
Wow.
as well. Yeah, I love all that. Like I'm the biggest geek. Like I said, biology is my thing. My kids are sick of me. The older two, like when we do like like family trivia when it comes to science, they were like, we're not playing, because you always win. We're not playing. I'm like, come on, just try. And they're like, how do you know these things? And I just naturally, I'm just drawn to biology, chemistry, like science in general.
I love that. You go do sports therapy. That's such a big jump, though.
Listen.
Wow.
I,
Sports science. Sorry.
Yeah, I don't even know, but I'm a sporty person as well. Like I used to play netball, all these things, like rounders. That's my thing. But yeah, it's just natural. Comes natural to
Would
me.
you have gone into like the massaging of like the muscles and that, or would it have been like what was your goal when you were doing that? What was your aim?
To be fair, at first I thought I wanted to be a pediatrician, like a baby
Kids
doctor.
doctor, yeah.
Yeah. But then I was like, I've seen some of you doctors and I'm not mean like that. Like I've got bedside manners and all this. Like I'm, not saying not all of you are like that. And then, like I said, when I had my first baby, got pregnant, I was like, yeah, this is me. Because I always went to work. I always was excited to go into the hospital. When I was younger, I had my kidney removed, and in hospital, I said to the doctor, "Please don't take it out when I'm at the when I'm at school. Like, wait till I'm on holiday." And he was like, "You are the first child that doesn't want to miss school."
That's mad. Wow.
He was like, "Are you sure?" I was like, "Please do it in the half term. Like, I don't want to miss school. Like, I love school.
Bless
I
you.
loved secondary school."
Did you?
And he was like, "Wow." He's like, "When you're ready, come and see me. Like, you've got a place here." And then I changed, and I was like, "I like women. I like the body, maybe." And then midwifery, yeah.
That's so
When I used to go to the
beautiful.
hospital and I was ill, I used to get excited. My mum was like, "You're the only child. Like, something's wrong with you, and you're excited to be here."
Do you know what's funny though? I loved Great Ormond Street as a child.
Really?
Yeah, I had to go in there a few times.
Wow.
And I loved going to Great Ormond Street. It was such a vibe. I
Yeah.
remember thinking, I want to stay here for a little
Do you
bit longer.
understand?
Because
You
they were just
stay
so
there.
nice. Everyone was just so lovely. St. Mary's.
No.
Oh, I can't stand hospitals. It gives me
Really?
anxiety.
No.
I don't like
Oh,
it.
bless. Yeah, there's a lot of people like that. My daughter, she's like, "Mum, no,
It just gives me
no."
dark vibes.
Yeah.
Really?
Yeah.
I think it depends on the hospital because St. Mary's gives me dark vibes.
Mm.
For me, I feel like what kind of experiments did you lot used to do here back in the day?
That's hilarious.
That one gives me
True.
very dark vibes.
I just
But, like-
associate hospitals with pain.
I hear
death,
you. I hear that.
illnesses. I mean, what else are you there for?
Because you do, isn't
know what I
it?
mean?
Honestly. Other than like pregnancy, if you take that out of it, everything else is because
Everything
you're
else is bad
unwell or
vibes.
you're ill or, yeah, something's wrong, an ailment. But that's why I'm like, to my team, I'm like, when someone phones, you have to be like, knowing that you're the first person contact. Even when you go into a hospital, I have such issues with admin staff, receptionists, GP receptionists, because you don't know what's going on with someone. So when you walk in and you don't have a smile on your face, someone could be coming in to get news, bad news, you don't know, or someone may have got bad news and you're going to give them their next appointment. Just greet someone with a smile. A smile can take so much away from just greeting someone with a sour face. And like you said at the beginning, you know, with the weight of their, you know, life on their shoulders, leave it at the door because you've come into this profession. So, you know, just smile, even if you're smiling through gritted teeth. Some days I struggle to come in because I've got so much going on, but I know these women are counting on me. Like, they're relying on me.
It makes such a big difference, man.
I'm
Jemma.
telling
don't
you.
understand. Like, you feel safe when you have a midwife who's so nice, and like it makes a huge difference.
Some women will come in sometimes or with their partners, and their partners will give it to me. They'll be like, "We were waiting half an hour," da, 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 da. And I'll just be like, "Jemma, just count down." And I'll be like, "I'm so sorry.
Yeah.
We've been backed up today. We've had an emergency, but I just hope that by the time I'm finished with you, you've asked all your questions. I'll support you. Let me know what I can do." And by the end of it, we're all out there laughing and smiling. Sometimes they leave and they're smiling, and then they're, you know, they make a complaint. But what can you do? What can you do? You're only human. What can you do?
But if there's like a backlog,
you
it's not your
do?
fault though, is it?
The most you can do, I think for me, is communication. The most you can do is come out and say, "Look, I'm so sorry. We are running late, but we will see you as soon as we can.
Yeah.
Would you like to stay? Would you like to reschedule?"
Yeah.
That's all you can do. But
That
some
is
of them
so
will be like,
rude.
"Yeah,
They'll
that's
kiki
what-"
with you and then they write a
Yes.
complaint after.
And because I'm the manager, I get the complaint.
Oh,
So I'm
mad.
like, "I'm so sorry,
Mad.
but it was me that saw you. Things didn't quite go like this, but I understand where you're coming from." And
Imagine,
the
imagine,
fuck you
imagine saying, let's
lying?
let's report her to her manager, and it's you. Goodness.
or they'll be
me.
like, "Can I speak to the manager?" And I'm like, "Yeah, that's me. I'm taking over the clinic because a member of staff
I love
is
that vibe. I
off,
love
you
it.
know, they're sick, so I'm covering the clinic. That's why it's
Yeah,
been running
it's me.
late."
I'm the manager. How can I help? Like,
But,
bitch.
you know, there is someone in front of me or above me that you can go, "Yes, I want those details." No problem.
Yo, people are so miserable sometimes.
They don't get it. They don't get the strains that are on the NHS. They don't
Yeah.
get it. Like, there's waiting lists. There's so many people coming through the doors. They don't understand.
Listen. Do you know
But
how many times, like, while I was waiting for my midwife appointment, I'm sitting there another 20 minutes. But in my head, I'm like, there could be a mum who's going through like a mental health crisis and she needs more time. Like, there's always something where I'm
There's
like,
always
something
something,
must be
yeah.
happening. I can't be sitting here complaining.
yeah,
The only
is what
time
it
I'm
is.
stressed is if I have something that I need to do after that's pressing.
yeah.
But if I like my whole day is dedicated to this appointment, I'll sit there for 1 hour. I'll sit there for
Exactly.
2 hours. Who cares? I'll put my headphones in and I'll go on my phone.
And that's the thing as well. I say to my clients as well, look, try and not have something to do afterwards because it can
Yeah.
run late.
That's when you get stressed and you start thinking,
yeah.
oh my God, the trains, oh my God, the bus,
Yeah.
oh my God,
But
traffic.
also,
Yeah.
if you are someone that's working, you by law, you can take time out for your appointments. And some of them are like, really? I thought I had to take them on my day off. No, you can do it within your working day. So it's, again, it's information sharing. It's just giving women information they need to feel calm and less anxious and knowledgeable.
They have to fill out a form for that, isn't it? Is it called the MAPB one?
That's to get your maternity leave.
That's the maternity leave one, isn't it?
That's to get your maternity leave. But generally, you don't need to fill out a form to have your antenatal appointments.
Okay, you just have to let them know.
You just need to let them know. Yeah.
Technically, they still have to pay you sometimes for that day.
If you've, yes.
Yeah.
Yeah.
It's not, and it doesn't count as annual leave as well.
No.
It's not annual leave.
No, it's
Yeah.
not annual leave.
I had to learn that the hard way when I was
Yeah.
working, when I was pregnant.
It's just peak for people because there's a lot of people that don't tell their
They won't.
the
work
employers won't tell
colleagues
you
or
that.
anyone
Yeah.
that they're pregnant
Yeah.
until they start
They
showing.
start
or
showing.
whatever.
And that's what, and
So
those
how
are
do
one
they
of
go
the,
to appointments? That's what I want to know.
so they'll say to us, can we have an appointment after 6? Who's working after 6 on a weekday?
Yeah.
Or, can we have it on a weekend? Who? Where? We work on a weekend, but different clinics. So it's just like, look, this is what we can, this is what we have, this is what we're working with. But if you don't want to tell your employer, that's fine. But you need to work it out and we'll help you. But we can't make a life for you or something, But and that's why with Hyperemesis, people keep their pregnancies quiet and don't say nothing. But I think with Hyperemesis, as soon as you're pregnant, say something so you can get the support you need. Because trying to hide a Hyperemesis pregnancy.
How?
Hey.
How are you going to go to work?
I tried.
They're going to see it anyway.
I tried.
If they see you going back and forth in the toilet vomiting, they will
Some
know
women are
straight
like,
away.
I'm like, how did you get out of work? She's like, I told them I had a dodgy curry. I said I went here and I got food poisoning. I said, what? Food poisoning every week? Exactly. I said food poisoning every week.
Every week you have food poisoning.
Stomach bug.
No, that's crazy.
Virus this
Listen,
week. Next week,
this
food
one.
poisoning.
I was like, we've got to find something else, honey.
That's crazy.
Tell us, even if it's a trusted person at work, just tell someone so they can support you. They can say to you, take time off. And now that COVID has come and gone, workplaces are screwed. Because if it's a job where you can do at home, you can say, look, I'm not well enough to come in. Can I work from home today? Because when you got Hyperemesis, some women can work from home and they can still manage. Me, I wasn't one of them. I couldn't work full stop. And it's the financial impact of Hyperemesis as well that people don't talk about and don't realise. It impacts your finances. And if you are because you can't work. Remember, if you've just come into a job and it's new and you can't go to work, or if you're self-employed and you can't work.
Be vomiting all day and working.
Not just that, you're buying food and all you're doing is vomiting it out. You've got to keep buying food. For me, if I vomited something, I didn't want to eat it again. So imagine I had this thing for mashed potato, pour potatoes or mashed potato, vomited. Don't want it.
Yeah,
What
that
do I do with
happens
this
to our
food?
friend as well.
And then you would obviously experiment with different things. You're
Right.
constantly buying different things to see what works.
It's expensive. It has a financial impact. And if you're someone that you don't have a partner and it's just you,
long.
That's even worse.
yeah. And then if you're someone that has a partner or you have a child and you want to put your child in childcare because you can't manage looking after them in a day, financial impact. So it doesn't stop on just the vomiting and the nausea. There's so much more that comes along with having Hyperemesis. People don't realise.
Can you imagine having Hyperemesis and you've got kids?
Listen.
A toddler right there.
Who was
my
it? Yeah, when I'm glad that the older two were older, but when I had my second, my daughter was 4, and she was just like, "What's wrong with my mummy?" And I remember she called the baby crap because every time someone said, "How are you feeling?" I said crap. She associated the baby and said, "It's crap, making mummy not well." So even with the young ones watching,
So sweet. So funny.
That must have been so long. A 4-year-old, and then you've got
and then when I had the last one, the older two were like, "You look dead, mum. Like, you look real dead."
Even with that 13-year gap,
Yeah.
your body still hasn't forgotten.
Didn't
it.
even,
It's
like-
mad. It's me.
There's so many times in my head I'm talking to my body like, "Do you not remember this? Like, do you not know how to do this yet? Like, have we not worked out how to just be pregnant and be happy and have glowing skin and go for maternity shoots and go for brunch and lunch with
Do
our
yoga.
girlfriends?"
And just do yoga with your friends.
Did you I wanted to ask, what was the question I was going to ask? I was going to say, when you found out you were pregnant with your third, did you feel anxious thinking, here we go again?
I was
with HG?
petrified.
Oh shit. Here we go
I was
again.
petrified.
I'd be too, man.
When I saw that
Jeez.
pregnancy test, I was like, I feel pregnant. And I was like, I'm not taking pregnancy test. I can't face it. Like, I'm not. And there's one point I was like, Jemma, just do it because the nausea is nauseating.
Ugh.
And you know, you close your eyes. I peed on it, close my eyes. I was like, I don't know if I want it. And I looked and I was like, oh my gosh. Listen, the way my heart started to beat out of my chest because I was like, I don't know if I can do this. Like, I genuinely don't know if I can do this. I'm petrified. We're going through COVID. What am I going to do? And at this point, the hospital that I delivered in, I always went back to them because I trusted them. Obviously, my midwife was there and came from there. They had all my history and my notes. But I was like, who's going to look after me? My midwife is gone. Like, who is actually going to look after me? Are they going to know? Are they going to understand? I don't think I have the energy to say this. From the get-go, I was like, I have hyperemesis. Please pull it all over my notes and make sure whoever needs to be involved is involved because I'm genuinely can't do this on my own. I'm struggling. I'm scared already. I'm in tears. And again, I got to my 6 weeks and one day and bang, the vomiting.
6 weeks and one day on the dot.
I get to 6 weeks because I got to 6 weeks and I was like, hey, I made it. Like, no hyperemesis. I just feel a bit, nauseous. The one day, the 6 weeks and one day, by the
way it's on time every time is crazy.
That's mad
6 weeks and one day.
I was like, here we go again.
There must be like something where the baby, something has changed.
It's
like,
when the
hormone
placenta
has
starts.
shifted.
Yeah, it's the body. It's when there's so much research going into it now from America as well. But there's this gene, the GDF15 gene, that they're looking into researching that's got a lot to do with it. And it isn't just as simple as when you have a boy, or if you have a boy or have a girl. It's not even as simple as that. But as soon as that, for me, it's just like, here comes the hypersalivation, the vomiting kicks in, and it's like, and you have this feeling over you. Like when you have hyperemesis, for me, I have this aura over me, like the smells. And I tell you, the most powerful thing in the world is hormones. I've always said it. The most powerful thing in the world is hormones because you see hormones. Wow. Like, yeah, hormones. Yeah. Like the nausea, the vomiting. And it's just like, when I was in the early stages, I think between 6 and 9 weeks, I had the TV on in my room and I was listening to Friends and Fresh Prince. And after I had the baby, I couldn't watch Friends or Fresh Prince because it was a trigger for me. It brought me back to being in my bedroom in the dark, vomiting. So I couldn't even watch it.
Mad.
Damn.
I couldn't even watch it. I couldn't be in my room for a while either because that's where I associated my darkest times. Like, I had to completely change my room over because I was just like, it's too much. It's so much.
9 months. Like that's almost a year,
Bruh.
That's January to September.
Hello,
like,
hi.
That's a long time of
vomiting and feeling that way.
Oh,
and then you get the stomach ache because your stomach keeps tensing and
The dry heaves as well. I don't even know how you dealt with that because I hate dry
I
heaving.
was just like,
I hate that feeling of retching and then
yeah.
the bile. Like, there's nothing.
my
I
children.
hate
Do you
more than
guys watch Twilight? Is it Twilight?
that. No.
Nah, I wasn't into Twilight.
Me
I
neither.
wasn't into
But
Twilight. I wasn't into
apparently, I look like one.
One of the
The
vampires.
vampires.
Some
No,
sort
the
of
grey ones.
vampire or werewolf. My daughter said that when she was pregnant, she was dying because she was pregnant. That's what I look like. She said, "Mum, your lips are black like hers. You look like a corpse like her." Yeah, found the picture and showed me.
You look like one whole vampire.
Yeah,
That's
she said,
nuts.
"Mum, this is what you look like. This is what you look like. You look like you was literally dying." And when women say that's how I feel, that is what hyperemesis feels like. You feel like you're dying. Like you're not gonna survive. You're literally fighting for survival.
Listen, one vomiting session.
Yeah.
And I'm like,
Done.
Wrap it up.
this is disgusting.
Listen,
It's the worst thing.
Vomiting is the worst thing ever. Like, I hate it.
vomiting is not.
Did you
in
vomit
my...
even once?
Bro, I vomited with Jenna's pregnancy. I had a very easy pregnancy.
Mm-hmm.
But this happened out of the blue. I ordered 6 wings and chips. Yeah, this was COVID times. I ordered 6 wings and chips. It came. I took one bite of the chicken wing, and the whole thing just came out, and I caught it in my hand.
You caught the vomit.
Yeah,
That's
because
nuts.
it was crazy because I didn't want it to go all over me.
You know, isn't
I went
it?
like this. It was quick. It came
That's
out straight away.
That is me in Nesquik. I got into this thing of strawberry Nesquik, and I had it with cold milk, and I was like, this is nice. And with me, I have to drink slowly, but naturally, I drink really fast. I drink really quickly. So I was drinking. I was like, this is nice, and I just started gulping it. Before I could say hyperemesis, I was like, bowl. Listen, the vomit just came back up, cold, through my nose, through my mouth, in chunks. I was like, forget it. Nesquik.
Oh, you must have had a strawberry nose.
Haven't,
That's long.
I haven't been near it since.
No way.
Nope.
You're completely off it.
Nope. And that was 21
Is
years
there
ago.
anything else that you're put off now?
That was 21 years ago.
Mashed potato, I'm a bit funny with.
Okay.
Not the mashed potatoes.
Down.
Apple juice. That came up through my nose. I was like, no, thank you. So it has to be a type of apple juice. I'm a cheese lover. Cheddar cheese saved my life. I used to nibble on that throughout my pregnancy.
Same.
Yeah, it just helped me. I don't know if it's the tanginess, the salt probably as well. What else? Salt and vinegar crisps would last me a whole day. That helped because you know when you need your
Salty
electrolytes.
as well.
But not much. My first pregnancy, oh my gosh, my doctor, she could have wrung my neck. I got addicted to Red Bull.
Damn.
Red Bull and original Lucozade because that's all I could tolerate. It gave me a kick that I needed. So I would get a kick for like 15 minutes, do what I need to do and start vomiting again.
Mad.
So when I went to see my doctor, she was like, your pulse is really high. Like, what's happening? What?
Hey.
And I was like, oh, maybe it's the Red Bull. She said, what? She said, you're banned. She said, stay away from it.
Did your kid come out hyperactive?
Let me tell you something about my child. You see that 21-year-old addicted to Red Bull?
Swear down.
She's addicted to Red Bull.
Crazy.
So I had to say to her, she's like, Mom, what? I said, I have to confess.
Oh, mad.
I said, stay away from it. When she told me her favourite drink, I was like, that is not a favourite drink. I said, that's not,
I
why?
don't know how people drink Red Bull, you know. It tastes like medicine to me.
I love it. The original one.
And cold as well.
And it has to be full fat, not the one with the less sugar.
Yeah. And
I love
also
it.
when I'm pregnant, I can't eat hot food. It has to be cold.
No.
So I'm eating cold chicken. I'm eating cold jollof rice and peas. Everything is cold. My daughter's the same now. She eats her food cold. She waits for it to cool down, then she eats it.
Really? Wow.
That's so crazy how it goes to your children.
Yeah.
Because like for me, I towards the end of my pregnancy, I had like proper nausea, but like I had vomited like maybe like 4 or 5 times in the whole 9 months. And there was one day where we were driving and the car, motion sickness, vomited my guts out in the service station. I managed to hold it. It was like right here. I managed to hold it until I got into the toilet of the service station. Another time I was cooking in the kitchen and I literally into one of the pots that I was cooking in. Mad. Another time, I can't remember exactly how many times, but I was feeling really nauseous and I was eating watermelons and just chunks of watermelon came out.
Listen.
It was, I don't even like watermelon. I was only eating it to get rid of, you know, the acid. Yeah, I was eating it to get rid of the acid. It worked, but then when I vomited out, it wasn't fun.
Yeah.
But towards the end of my pregnancy, I drank a litre of Lucozade, the orange one, every day.
No way.
And it sounds crazy, but I couldn't function without it.
Yeah.
I felt like it was like a strong craving, but also like I needed it.
I know what you mean.
Oh, you know, like the litre one. And anytime someone was like, I'm gonna come visit you, I'd be like, yes.
Did
Bring
you not
a
get
crate of
diabetes in
Lucozade.
pregnancy?
No, I didn't. I
Hey,
didn't.
Thank God.
And I had 1 litre every day, sometimes more, every single day for like 3 months. It was mad. My kid is now hyperactive.
If Hannah starts back at Lucozade.
Oh no, she loves it.
Does she?
You know, for like the first like after she turned like 1.5, she didn't like my kid has never liked Calpol. My kid has never liked Nurofen. She doesn't like any of those medicines.
Yeah.
But when she gets fever, I have to give it to her.
Yeah.
So I'd get a small shot of Lucozade and I'd mix it in, a little bit more Lucozade. She'd be like, she takes the Lucozade. She's like, she backs the medicine. All of a sudden, temperature's gone down. I'm
There
like,
you
well, that
go.
works.
There you go.
That's literally how she drank medicine
Listen.
for the first 2 years of her
By
life.
whatever means possible to get these kids under control and well.
Fever.
Because, yeah.
You know them ones. What can I do about fevers? Are scary.
I'm telling you.
Oh, do you know what I
Fevers are
really loved though?
scary.
When I was pregnant with Jenna in 2021, listen, I started backing Diet Coke with ice. It tasted
Really?
absolutely
Diet Coke.
It had to be Diet Coke.
Ew.
No.
In it?
Not full
Sorry.
fat.
Full fat.
It had to be Diet Coke. I was just backing
Ew.
it.
Yeah.
Yeah, I loved
I mean,
it.
whatever works.
Oof.
Whatever works. That's what you got
Wait,
to go with.
Adam
whatever
was
works.
Dr. Pepper.
love
You know how I
Dr.
remember
Pepper.
this?
Hey, listen,
She
I
was like,
still
I
love
love
Dr.
Dr. Pepper.
Dr. Pepper, even now,
I love Dr.
you will
Pepper.
always find a liter of Dr. Pepper in my fridge.
No way.
Always. My
Everyone
brother
always
my brother
makes
stayed
fun
in my
of me.
flat while I was on holiday. My brother and his wife were staying at my flat, and just a few days before I came back, he was like, "Is there anything I should like buy?"
Replace.
Because we used up everything. I said, "Make sure there's Dr. Pepper in that fridge." I didn't even say blue milk or nothing. I said,
Forget the
Dr.
milk.
Pepper.
Forget the snacks. Forget everything.
I said, buy that Dr. Pepper, okay? I love
Honestly.
it. I love it so much.
Honestly, we just get these cravings. Honestly, I'm just glad that I didn't vomit cheese or go off cheese.
Oh no! You know what? The first 4 months, I could only eat cheese sandwiches.
Yeah, white bread.
No, the seeded bread, the
No,
brown seeded
white
bread.
and I'm not a white bread lover.
I don't like white bread at all.
I'm brown bread.
You know the brown seeded loaf.
Yeah.
It's from where was it from? I think it was Tesco's, but it was so thick and like
Yeah.
fluffy and soft,
Mm.
and it had like I don't know my taste buds. It doesn't taste the same now, but then it had this taste, and I was like, wow, what is
Yeah.
this crack? And
Yeah.
I remember I used to make like the sandwich same as you.
Yeah.
I'd cut it into 4, and for like 3 hours I'd be eating each one.
Yeah,
And if I did it like that, I would be okay.
Yeah.
If I tried to eat it all in one go, I'd feel sick.
it's not happening.
But cheese, I could only live off cheese,
Cheese,
and it
yeah.
had to have cucumbers. I had to put
Yes.
cucumbers in the sandwich
Yeah.
and tomatoes.
Yeah, no, not tomato. You're
I
pushing
had
it.
to put tomatoes.
No, just cucumber and cheese or
Yeah.
just cheese on its own.
So delicious.
It just saved my
And
life.
butter.
Literally, yes, but not too much butter as well.
Because
Just-
butter has
just-
the oil. And
yeah,
yeah,
the oil makes you
just-
feel a
just
bit
a little-
queasy.
yeah.
Yeah, just a little spread of butter and that was it.
No, honestly, cheese, me and cheese.
Yeah.
Yeah, I love the
Listen, cheese
man.
and grapes,
Oh my god,
cheese and
Listen.
cucumber.
Do you like
oh
charcuterie
my god.
boards?
Yes,
Come on.
yes,
Charcuterie boards?
yes. I can do. We can do this all day.
Onion chutney.
Yes.
Caramel.
Yeah.
Oh,
Yep.
God.
Have you ever had that Wensleydale cheese? The one that's
Hey.
got cranberries in it.
Oh my god.
Crack.
Listen, I'm telling you. Just leave me in a
Crack.
corner. I'm okay. Don't check on me either. I'm fine.
Listen, come to one of our events. We always have charcuterie boards.
Okay, cool.
Yeah, yeah, yeah. We
I'm
always have it,
coming.
yeah.
I'm coming. You sold me already.
I always have
I'm coming.
I
Makes
always
a
have
massive
it.
one.
Yeah, I always have it in my house. You could always put together a cheese
Oh,
board. Because
Love that.
listen, I
I
always have
yeah,
the
me
cheese in my
too.
yard, man.
See, I love this. This
I
is
love
what I'm
that.
saying. Yeah, I can do this all day, all day.
So
But
I've
yeah.
got a question.
Mm-hmm.
Obviously, you experienced HG multiple times. Now, as a midwife, how do you support mums? Like, have you experienced like a mother coming in with like really debilitating HG, and how did you support her, knowing that you've been through that?
I think for me, there is, like I said, I have a team around me. And the first thing I do with my team is just explain to them what HG is. I explain to them, look out for the signs, the symptoms, and even if you don't feel confident caring for someone with it, what you always need to do is let them validate them and let them make sure you hear them. Because I think as a HG sufferer, that's the first thing we want to know is that you hear us. And even if you don't have the vomiting and you just have the nausea, hear a woman when she's saying, I'm not coping, or I need your help, or this is what I'm going through. And don't just brush it off as I was just mourning sickness, because it's so much more than that. That, again, like I said, it can be the difference in continuing with a pregnancy and not continuing. So I always make sure I validate my woman and I make the referrals quickly. So to see the consultant, speak about medication. If they don't feel comfortable speaking about medication, just find someone who is. And sometimes you have to have that conversation with the GPs and say, look, do you know much about it? And some of them are honest and say, look, I don't know much. Can we work together on this and tell me what I need to do, what medication looks like and what have you. And again, another thing across the UK is the issue with Zomvia.
What's that?
It's a medication, anti-sickness medication, but it's licensed. A lot of the medications, like I said, are not licensed in pregnancy, but Zomvia is. But the issue is the cost of it. Like, we're just going to be honest. The cost of it is quite expensive compared to like your cyclizine or your other anti-sickness medications. I'd always explain to the women and say, look, medication is out there, because a lot of them will say, oh, I thought I just had to ride this out for 9 months.
Yeah.
No, you know? So that's validating. It's medication and it's mental health. Ask them how they're doing. How are you feeling? How is this making you feel? Are you able to go to work? do you have support? Do you have family around you that understand? Because sometimes you can have family around you and they don't understand.
And
they
make
just
everything
like,
worse. Yeah.
and they're just like, eat, or they're giving you a cultural foods. Me, I couldn't have, I'm Caribbean, I'm Jamaican. I don't want jerk chicken.
Yeah.
You know, I don't want rice and peas. I don't want my traditional food because it's making me feel unwell. It's too strong. It's too seasoned.
I can imagine aunties saying things like, "You need to feed the baby."
Yeah.
Like, you've got baby.
You're
in there, you need to
starving the
eat."
baby.
Yeah.
How can I eat when everything's coming out, bro?
And it's funny because my mum had hyperemesis, but obviously back then in the 80s, it weren't diagnosed, so you wouldn't know. But when I was pregnant, she was like, come on, eat. You need to eat. And I'm like, no, I'm vomiting. I can't eat none. So when I was in hospital and she brought me the food, I was like, Mum, I can't eat it. And I know she felt offended. But I was like, Mum, please don't feel offended. I just can't eat it. It's too strong. There's too many things going on with it. So I think one day I had boiled rice, and this is from the NHS, so boiled rice, no salt, cauliflower, and I think egg quiche. I was like, this is banging. This tastes so good. Yummy. And my mum's looking at me, giving me side eye like, I brought you jerk chicken, rice and peas, coleslaw, and you're talking about this bland looking food. I was like, Mum, I'm so sorry.
That hits more though, innit?
Yes,
So I'm not gonna lie, jerk chicken, rice and peas, all of that.
Listen,
Oxtail, all of that.
I was like, no. So yeah, the validation, the anti-sickness medication, and the knowledge. Like, give her the knowledge. Tell her what's normal from what's not normal. If you are vomiting more than 5 times a day, if you can't keep anything down, if for 24 hours you haven't had nothing to drink or eat, hospital time. You need to get a drip. You need hydration. Otherwise, you're going to suffer dehydration
before your veins disappear.
Right.
Yeah. Before your veins disappear.
I've got so many scars. I've got cannula scars.
Oh my God.
From where they couldn't get in, where they struggled. Yeah.
Oh my God.
But it's the knowledge. It's telling women. After I had this baby, everyone came in and gave me a round of applause because they knew me for the 9 months. They knew me, knew my name, knew everything.
Oh my God.
Gemma, how did you do? Do you know you're famous here? I said, famous for what? Vomiting? They said, yes.
Oh my God.
Yeah.
That's how we felt when our friend Zainab, we kept saying free Zainab. We couldn't wait till the baby came out.
Free Zainab. We literally
hashtag
free Zainab.
She was in prison.
Bro.
So was I.
She was
Listen,
imprisoned
so
by the
deep,
HG,
bro.
man. The HG had it by
6
the
weeks
neck.
in hospital, and they used to let me out on day release and come back.
Not like
And-
you're a prisoner.
Do you understand? Day release. And then when I used to come back,
They said you
were
got
like,
bail.
Probation.
They were like, you're not going. Your blood pressure's like 150 over 102. They're like, no, it's not good for the baby in you. I just cried. I was like, so I have to stay here, looking at these 4 walls, listen to everyone have their babies and go and come, and I'm just here vomiting, looking like a corpse. Oh my God. I said, listen, well, I have to go downstairs and get some air. I can't stay in these 4 walls.
Did they at least give you like a room by yourself?
No. Oh yeah, by the time, yeah.
Oh,
They moved me. By the time I was in there for like 3 weeks, 4 weeks, they were like, let's get you a side room because you're not going anywhere.
Oh my God.
And it's when and I should have known, you know, I should have known when they moved me. I should have known, like, because they were like, oh, you're going home tomorrow. You go, tomorrow never came. 6 weeks later.
6 weeks though.
Yeah. Then I went home. Then I
can't do
come
more
back.
than 2 days in a hospital, man.
I went home, and that's what I'm saying to you. I should have known where this was heading in terms of midwifery.
No, they
because
really said we'll put you in a, what do they call it in prison? They call it
What?
Isolation.
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 They put you in isolation.
Why are you asking me like I've been to prison?
You answered though. You answered though.
You got the question right.
I ain't never been to prison. I'm gonna look disclaimer. I ain't never been to prison.
No.
No, you started the
listen.
prison talks in it. I thought, let me ask her.
Listen to me. That time in hospital, I knew everyone's name. I knew
Wow.
everyone's shift pattern. I knew
No
the doctors. They were
way.
like, how are you, Gemma?
Goodness.
I was like, you know my name.
Goodness.
So did you even look at my folder or do you just know me?
Can you call Susan?
Listen. Then I started reading my own notes. They were like, you can't read your own notes. I was like, what? I was like, they're mine. They was like,
my
you can't read your own.
God.
Yeah. I learned so much being in hospital. It's crazy. I used to even pack the contraception packs with my midwife for the women going home. Pack them up, put the condoms in.
you were out here
I was
working.
working. I was working without pay.
Did they pay you? Did they pay you for that?
I was working without pay.
Goodness.
No, but you must have been so bored. That must have been entertaining.
Bored.
I
Oh
would
my
have put on
God.
some scrubs, man. What do you mean? I might as well work.
For real.
No, but remember,
Can I
I'm still
borrow
there
your
with
scrubs?
hyperemesis. I'm weak, innit? So sometimes I'll be able to get out of bed. Some days I'll be like, can't move today. And that's another thing. DVT, deep vein thrombosis, blood clots.
Oy.
When you have hyperemesis, make sure you have TED stockings. You know, the flight stockings?
Yeah.
Because when you're not
Compression
moving out
socks.
of bed, you're at a high risk of having blood clots as well.
Clots, Yeah.
Yeah. So make sure you've got your
I
stockings.
think my aunt had a blood clot
Mm.
because she was doing the whole the saliva
Yeah.
spitting in the bottle,
Mhm.
and then she would vomit.
Not
And
moving. Yeah.
She's so funny because she had a blood clot like in her leg, like here, and it was like really close to like major arteries.
Yeah.
So they were worried about her, and we had to look after her at home. She had
Yeah.
like the injections,
Yes.
the blood thinners,
Yeah.
I think they're called. So she had a blood clot. I think it was either in her hip or it was here. And me and my cousin were carrying her to the toilet because she couldn't walk on her
Yeah.
own. And he's really tall and I'm like small. I'm smaller than him. He's like 6'4", and we're just carrying her. And he was like, "Ha, that's a perfect time to tickle you." So he tickled her while we were walking to the toilet, and she just peed on us.
Yeah.
And she
'Cause
reminds
what
us all the time. She was like, "You lot are little shits." Because remember that time when you made me laugh so much that I peed on you? And he literally goes around telling people, "Oh my God, she peed on me." It was the
Well,
funniest
yeah, so
thing.
you're right.
She had a blood clot. He's
I know,
like,
right?
"Why would you?" She's like, "Why would you tickle me
Of all
and
the
have a
things.
blood clot? Why would you do
I would
that?"
have been fuming, man.
To be fair, I did tickle her too. So
Of course
You guys are not. So you're lucky she didn't
Yeah.
vomit on you.
she peed on us.
Well, yeah. That's what you get. Honestly.
And then you guys had to clean her up, innit? Obviously.
Yeah, obviously.
It's a long day.
And then you know what it is, we have to put her on the toilet, and then we had to lift her up
Yeah.
and take her off the toilet,
Yeah.
and then take her back to the living room. We had to get her changed. Like it was a lot.
It's a lot.
And I
People
was
don't
I was
realise.
jobless, and I had no education at that time. Like, I was off. I had like a
Yeah.
year off. I spent 3 months with her. I looked after her for 3 months.
Oh, see?
Yeah, it was mad.
Honorary midwife.
If I ever wanted to, I mean, I also have my maternity champion.
There you go.
So I could, I
Come
really
on.
could. But I'm not gonna lie to you, the 12-hour shifts and
I mean, that's only part of it.
yeah,
I don't even
that
do
is-
12-hour shifts. Well, I do, but I don't.
can't
So
do
I'm in a
12-hour
community. So I do kind of 9 to 5. But when I'm on call for home births and stuff, it's like a 12-hour period. But you can find other avenues. You can still do 9 to 5. Come to the community.
I could, I actually wanted to for a while.
I think you should. We need midwives like you that are caring, loving, funny,
Yeah.
bring
Make people
smiles.
laugh in their
Yeah.
moment of need.
You
No,
can.
100%.
Even
know
when
what?
my
I
women,
think about it.
even think about it.
Think
Even
about
when
it.
my women are like upset and scared, and they just like help me. We can laugh. We can still laugh.
Would you take a volunteer
Where?
at the hospital?
Yeah, you can
Where you
volunteer.
work at?
We have volunteers all the
Because
time.
I would rather do that than actually do all of the education
Okay,
part
yeah,
to
we
get
have
into it and do
volunteer-
it.
yeah,
Because
yeah.
I'm not really cool with education.
It's fine.
I just don't like tests. I don't like exams. I don't like any
Okay.
of that. I hated GCSEs.
Yeah.
I hated every exam. I'm more like a practical, hands-on person.
You could do volunteering, or you could be a maternity support worker. They work just under the midwife, and they are valuable.
I wouldn't even mind doing that.
We like my MSWs that I have in my team are invaluable. They're absolutely amazing. Like, they're educated, they see how we work. The thing is, some of them just don't have the pin, the
Yeah.
registration, but they are absolutely amazing. They have their own clinics, they weigh babies, look after mums, take blood, so yeah, honestly, think about it. I think you'd be amazing.
That would be a vibe.
And you like holding babies and cuddling them.
Oh,
yeah.
stop it. My womb just goes like,
Not mine. Absolutely
my
not.
ovaries, I could feel the egg come out, like looking for, like, where's it going? I feel like my body's disappointed every month. Like, what the hell are you doing?
Mine's fine.
As soon as I have a baby, I'm like, yo, am I lactating?
I love
I
I love having my
feel like-
cuddles. It's the pregnancy part. It's
Oh,
the
yeah,
pregnancy part,
it's the
yeah.
pregnancy part.
If I could just skip pregnancy and go into labour, I'm good. I prefer labour over the 9 months of pregnancy.
Of course, what you went through, Jemma.
Yeah.
I was literally going to ask you as well, like, when your water broke, like, when you knew that's it, like, how did you feel in that moment?
Ecstatic. I was like, come on.
Oh.
I was like, the first time I was induced because I got preeclampsia
Aye.
So
with the
weird
first
too.
one.
Yeah.
I got preeclampsia, and that's one of the risks with hyperemesis as well. Like, a risk of, I didn't know. I'm telling you, it's only when I became a midwife and I read up and researched. I was like, because you know what the doctor said from my mum? It was a different doctor this time. He was like, just speak to your daughter because she nearly died, and we really wouldn't want her to go through this again. And my mum came back and said to me, like, Jem, don't do this again. I was like, how dare you?
Was
Like,
this
you
after your first?
yeah.
Goodness me.
And she was like, you nearly died. And you think your mum just like overreacting, like, oh, you nearly died. I nearly died. I didn't realise.
Damn.
I nearly died. I had the preeclampsia. I nearly died. Everything went completely left. Had to get induced.
Induction is worse than
Listen,
natural.
I did induction
Mate.
without pain relief. I just had gas and air.
Same.
I don't know what I was thinking.
I don't know what I was thinking.
I don't know what I was
Looking
thinking.
back, I don't know why I did
Because that pain.
Yeah.
Hey.
Did it start straight away?
Yeah,
as soon
because
as
they gave me the drip.
Oh, it was. Oh.
So it wasn't my natural contraction. They had to give me the hormone drips to get me going. So I feel like when it's natural, your body builds up. But when they're just like, okay, no contractions, bam.
0 to 100.
Yeah.
It's like, oh, this is interesting. And I was just like, I got this. I can do this. Like, this baby's coming out. The hyperemesis is on the stop. And I think that's what my drive was like. It's going to stop. This baby's coming. But preeclampsia said, my blood pressure was like 160 over like 104. Something ridiculous. Ridiculous. Then they had to give me the medication. Then they gave it to me too fast. I was like vomiting everywhere again. Peeing myself. Dripping with sweat. I was like, so you like just going to kill me off. I got this far with my hyperemesis and you're now just going to kill me at the end of it. So I was like, yeah, maybe not. But again, as you can hear, I had a few more pregnancies after that. But yeah, my mum was like, this is what you want to be a part of next time. I was like, sorry, mum. I was like, I can't leave my child by themselves, just one.
Yeah.
Like, they need a playmate or someone.
I mean, I have those thoughts occasionally too. And then I look at her and I'm like, maybe never mind. I was an only child. I was fine.
There
I
you
turned
go.
out okay.
There you go.
You'll be fine.
There you go. You've got cousins. But yeah, I went again. And I think when I went again, I tried to have twins. I prayed to have twins so that I didn't need to go again.
Yeah.
That was my mindset. If I have twins, I don't need to go again.
2 for the price of 1.
Yeah. No such
Bang
luck.
it out.
No such
No more
luck.
children after that.
And my cousin was like, she had twins. She's like, you don't want twins, Jem. It's so hard. She's like, you do not want twins. I was like, I do, because I don't want to be pregnant again.
Yeah.
So that was my thought process. But yeah, I had preeclampsia. It was the worst ever. Like, I was so swollen as well.
Oh my God.
I was so swollen. Like, I looked completely different. Everything changed. Like, it was a mess. Like, I literally was a mess. Like, I can't even lie. If someone says to me, like, when a woman came into me once and she was like, I don't like being pregnant. And she was like, please don't safeguard me, please don't. She's like, I just don't like it. And I was like, one, I'm not going to. Why don't you like it? She's like, the vomiting. And I said to her, tell me about your vomiting. Hyperemesis.
Oh my God.
And she was on her 3rd. She's like, I'm stopping here. She's like, nobody gets it. She's like, I vomit. I don't stop vomiting. I can't do this. And I was like, it's okay. And as soon as I said it's okay, when she said I don't like being pregnant, her shoulders literally dropped. She just took this sigh of relief and she looked at me. She said, thank you.
That's so mad, because who would enjoy that? You know, like, she doesn't have to feel bad about saying, I hate this.
She
like,
said
I'm vomiting.
she was like,
mad. Women feel afraid to say that they dislike being pregnant or being mums or having kids because they're afraid that somebody will say, oh, you sound like you're a risk to your children or yourself.
That's mad.
Like, immediately people feel like that. And it's not like that at all.
It's not that at all. It's, you are struggling so much that you can't. And sometimes there's a disconnect with even a relationship with the baby. Like, I know this last pregnancy I had with my last, I had antenatal depression. Like, I did, because of the whole hyperemesis thing. I know I had it because I was just low. At times I couldn't connect with the baby, and I was like, baby, please, mommy loves you. Why we, like, I'm just trying to look after you. I just want to meet you.
Yeah.
Like, literally talking out aloud to myself, to my tummy, holding my tummy. But no one will get that unless they're kind of going through it and understand, like, you're just fighting for life. So when I used to start to feel the baby move, it started to improve my mood a bit more and what have you. I was like, okay. When I got to 4 weeks, I was like, we are on the home stretch. Like, come on, baby, we can do this. And then when my waters broke, it was green. So the baby had poos. And I was like, so much for that. Because I wanted a water birth.
Yeah.
I just want all natural. But then, obviously, waters broke and it just changed. I had to be on the bed and strapped up to the monitor. I was like, I don't care. In a couple of hours, if not, I'm going to be free. Yeah. Like, this baby's going to come and it's going to be fine. And like, after I had the baby, sometimes 2 weeks, 3 weeks after, I still had the nausea and still had food aversions and didn't really like food and stuff like that. I still had that. However, I was like, the baby's here. No more nausea. And I was like, this is it. Tap, tap. I was like, that's it. We out.
Because I was going to ask about recovery time. Like, how, like, you said 2 weeks still had nausea.
Yeah. And I wasn't eating particularly well. And then, again, that affects your breast milk because I breastfeed. And I breastfed him just before his second birthday, which is the longest.
Wow.
Because the first one I did 11 months. The second one I did 15 months. And this one. And COVID, didn't we at home? Like, come on, let's feed.
You had time.
It's cheaper.
It was so much cheaper.
So, just breastfed. And, but I remember if you're not eating well, you don't have great production of breast milk, so you need to eat well. So you've got your food aversion still. So it was a bit of a struggle, but you know, I still pushed through. But I would still, it's not for me.
That's amazing.
I wouldn't be if I'm not even putting myself in that predicament because I can't.
No,
But that
so
he was my like 2 girls, no 1 girl and 2 boys. I'm good. But when my waters broke, I was like ecstatic. I was like, yes, we are here.
I can imagine, man.
I was like, ring the bell. We're here. We're nearly there. That finish line, I can see it now. It's not so blurred. But for that last one as well, bad postnatal depression.
Did you?
18 months worth of postnatal depression. Yeah, it hit me so bad.
Is it because of that big gap? And then you felt like you were starting again kind of thing?
Do you know what it was? It was the hyperemesis. I didn't know what I didn't know hyperemesis was the cause of so many things I was dealing with. So my depression, you know, my low mood, the food aversion, suicidal ideation. I didn't know that it was associated so much with it. And I didn't know you're 8 times more likely to have postnatal depression with hyperemesis. So these are the things that, again, are not spoken about. So if you are feeling this way, talk to your midwife and then talk to your health visitor and let them know. Health visitors should know about hyperemesis as well because it has a knock-on effect postnatally as well. You need that support group. You need that village of people who get you, who understand you. Because even going to mum and baby classes and you're like, how are you? And how was your pregnancy? Oh, I had hyperemesis. Oh yeah, I had morning sickness too.
It's not the same thing.
It's not the same. It's not the same.
Were you still able to go to work? Were you still able to go out and live your life? Look, that's the main difference.
Did you sleep well?
Did you have maternity shoots?
Could you drink
till
water?
this day, I've never had a maternity shoot, and I wanted one so bad because I just thought it's a part of pregnancy.
Baby showers, none of that, innit?
Had a virtual baby shower with the last one. Had a baby shower with the others, but maternity shoot, like I have got no pictures of me pregnant, and if I do, it might be just like a pass by, like I think I've got one picture of me pregnant with my first pregnancy. In my second pregnancy, I have no idea. One picture. So I think one picture in every pregnancy. One picture in every pregnancy. That's it. Because who's taking a picture? I felt ugly. I felt like I had breakout. My skin broke out. There was nothing glamorous for me about pregnancy.
When you're constantly sick, who's got time for photos?
Do you understand?
You're not in the mood or headspace.
I booked it twice. A friend of mine was going to do it for me. She called me. She's like, you're not right. I said, I said, I can't come. I just finished vomiting. I said, I can't leave. So what, vomit, didn't say cheese. Vomit. Nah.
No.
So I was just like, forget it.
There's no point even put on makeup because you know how like you get tears in coming out your eyes.
And the smell of the makeup as well. So I was like, this can't go on my face. How are we going to do this? The smell of makeup. So holding my breath.
Do you know, for real, makeup has a smell because my concealer has a weird smell.
Yeah,
and
it
every
does.
time I put it on, I'm like, this stinks.
It does.
It has a weird smell.
And it's so, these little things that people don't think about that are so huge that, you know, like it changes your whole persona.
Oh my God.
Like HG takes so much from you without even realizing.
I bet you feel even more annoyed at yourself because you're like, everything is bothering me. Like, it's not just one thing, everything at the same time.
My partner, with my first pregnancy, my partner couldn't kiss me for 9 months on the mouth because his lip skin smelled funny. His lip skin smelled funny.
Wait, sorry. I wasn't expecting that.
I was like,
she said, close your bottom lip.
Wait, I thought you were even going to say breath or something.
Put your bottom lip away.
The lip skin. You smelt that?
The skin. I was like, you went to kiss. I was like, I was like, kiss my cheek. Kiss my cheek. Anywhere.
What?
Just forehead. Not even my nose. Forehead or the two cheeks.
Oh my god.
Lip skin is
Lip
mad.
skin smelled bad. So bad.
Lip skin is mad. Not even breath, not even teeth, not even tongue.
No, lip skin.
Lip skin. You should have put some lip gloss on him.
Lip skin. Lip skin. I was like, something. So he was like, okay, let me go shower and come back, wash my face.
Mouthwash.
So he was like, I was like, no, I can't.
Oh,
You know, I'm
Jemma,
not
you
gonna lie.
really struggled.
That
Yeah, I
is
did.
so
I struggled.
Oh,
funny.
Jemma, you
Yeah.
really went through it.
That
man.
is so funny.
That's
I've
what I'm
never
saying, they
heard
think
of
I'm
lip
weird.
skin smelling funny.
lip
That's
skin.
mad.
Disgusting.
Your smell, like
Yeah.
sense of smell heightened differently.
All the way in Jericho, you know, all the way up there.
The skin of the lips is
Lip. It was nothing else. I was,
Was
like,
it chapped?
no, nothing was wrong. Nothing. Let me tell you, nothing was wrong. Nothing was
I
wrong.
would have said let him peel it off. But
Nothing
me
was
like this.
wrong. Nothing was wrong. Because I even said, come here. I was like, what's that smell? He was like, pardon?
his lips.
I was like, come here. And, you know, I was like a whole dog.
Oh my god.
Just sniffing. I was like, it's your lip skin. And he was like, what do you mean? I was like, just, and he went, washed, came back.
I can still smell it. Damn.
I was like, no.
No,
And you know what was
Jemma.
weird as well? And I can share this. This is a safe space, right?
Oh.
I used to like barbecue mini cheddars,
yeah.
but he used to have to lick it off for me first because it was too strong, then give it to me. So you have two idiots sitting there. One is licking and one is giving. So that's what I'm eating. He's licking it and then giving it to me to eat.
Oh.
That's how I was surviving.
Goodness.
I'm telling you,
me,
survival of
Jemma.
the fittest.
I'm so glad that you're at least like you're that safe space for mothers now because you really
Yeah.
get it, man.
I do, I get it, and there has to be a silver lining for HG because it's a very dark place, you know. Let's have it right. It's a very dark place. It's a big struggle, but there has to be, and obviously now coming out of it, you know, 21 years down the line, 4 years out the line for my last one, I can talk about it and I can make jokes out of it. But at the time, you're fighting for your life, so there is no. You couldn't make a joke about food with me while I'm going through it because I would tear your head off. You couldn't. You know, you couldn't say, oh, smell this and run away. I might punch in the back of your neck. No violence, no violence.
No,
But,
I
you know,
fully support that.
I hear it
What do
though.
you mean?
I hear it
Like,
because you just triggered vomiting.
You know, even, I tell you how bad it was. Me and my sister, I used to be so bad to my sister. And I'm so sorry, I love you. She used to come around me and she always smelled nice. Her perfumes always banged. Like, she smelled amazing. But you see, when I was pregnant,
Oh my gosh.
I was like, you smell. Well, I was like, why would you come to me smelling like that? She was like, I beg your pardon. I was like, you smell really bad. What is it? She's like, my good up perfume. I was like, I don't know. When you come, please take off your coat or don't wear no perfume. Don't come here smelling like that. My child came out looking just like her.
Oh my
My
gosh.
child came out looking just like her because we were like this. We were at loggerheads when I was pregnant.
My mum
She
says that
came
as
out
well.
looking just like my sister.
No,
She
my
might as well
mum
be
says
my
that.
sister's child.
No, literally, my
Yeah.
mum said that, you know, the person who irritates you the
Yeah.
most when you're
Yeah.
pregnant
Her
is
dad
who
and-
your child
yeah.
is going to look like.
Yeah.
It's crazy.
When I told him about his lip skin, that child said, okay, I'm going to be his twin. My sister
No.
and, yeah, her dad, that's who my child looks like. It's only now she's starting to look like me. But for the longest time, you didn't.
Wow.
Was I involved? Because I remember vomiting for 9 months. So was I really involved? Yeah.
That's so funny. My aunt, her and her husband, they were pregnant with their fourth. And my cousin just the sight of her irritated my aunt. Like literally just the sight of her, she was annoyed already. Like if she opens her mouth, my aunt's rolling her eyes, she's annoyed. Like she irritated the life out of her.
Yeah.
Why did that kid come out looking like my cousin's
Yeah.
twin?
Honestly.
When
It's a
she's
real
walking with
thing.
her outside, people
Yeah.
are like, "Oh my god, you and your daughter." She's like, "This is not even my sister.
Yeah.
This is
it's
my
a real
cousin."
thing. It's a real thing.
Wow.
So be nice.
It's crazy.
Be nice to people when you're pregnant if you can.
Damn.
Yeah. Otherwise, they're going to be the mini them.
Can
It's
we
real.
talk about? This is really exciting, but you're going to do a TED talk
Oh, yeah.
in September about HG.
I am. Thank you, guys.
Let's
I
talk
am.
about it. How you feeling?
Welcome to my TED talk.
Hey, that's sick,
Listen,
man.
It still feels very surreal.
Yeah.
It still feels very surreal. And I'm so grateful for this opportunity simply because at the beginning of this year, I said I'm going to be out of my comfort zone. I'm really going to try and do things that's going to push me. And and be at my comfort zone. And a TED talk, I was like, let me put that on my list. Let me just in case, just maybe put it on my list. And lo and behold, it came out. And someone sent it to me and said, look, I think you should apply. Your story is amazing. Like, you've got such a story to tell. And I was like, okay, cool. So I applied, didn't hear anything. I even forgot about applying. And then I saw the email and I was like, oh my gosh. I was like, congratulations. You've been shortlisted. I was like, oh, shortlisted. Okay, cool. And it came back and it was like, we want you to be a TED speaker, TED NHS. And I was like, oh my gosh.
Oh.
And I told my best friend and she's like, I was like, HG. I was like, you about to be sick of me. Literally.
Yeah.
Like, literally.
Pun intended.
Pun intended. Like, we're going to do this. I'm so excited. And I'm so grateful for the platform because for me, I'm always talking about HG. Like, it's my thing. It's my baby. And it needs to be out there. It needs the respect.
Facts.
It needs the acknowledgement. And there's so many women going through it. And the numbers are so small. And I hope after doing this TED talk, people validate what women are going through, understand, and respond. Don't just take that someone's got HG and like, oh, they've got HG. What are you doing for them? Are you supporting them? And this isn't just healthcare professionals. This is family members. This is friends, partners. What are you doing for your partner, your family, your sister who's going through it? Have you asked them how their mental health is today? Have they eaten? Do they need something specific? Go out and buy them ice if all they want is crushed ice. Take them to the doctor. If you're a healthcare professional, can you see them at home? Is it possible for you to see them at home? Can you tailor their care to suit them? Mental health practitioners, have you trained yourself with HG? Do you know what to do? Do you know how to care for that person? That's all I'm asking. And that's all I'm putting out there. It's those things. And if anybody needs support with HG, I'm here. I'm literally here. And as much as HG doesn't see colour, Black women are still coming out the worst.
Yeah.
They're still twice as likely to be hospitalised. They're still likely to have their symptoms dismissed, not taken seriously, not validated. I am here to validate your HG. I'm here to support you. I'm here to signpost you, put you in the right direction. I'm here to educate. Student midwives, student doctors, whatever. I am here. Like, people need to listen and understand. There are people that are wanting all pregnancies are important, but there are people that are going through some real life challenges, be it IVF, to find the money to get pregnant, to then be faced with HG. And then end up without that pregnancy because you just think there's no help, there's no support. When there is, come on, we need to do better.
Yeah.
And I think that is it. So this TED talk is, for me, the appropriate platform. I want to support people in the UK, but people in Ghana, people in Jamaica, people in different countries, people in Dubai. There are so many women around the world that are not getting help with this, that their mental health is on the floor. So this platform for me is like the starting point. Yeah. If nothing comes of it, then so be it. I tried.
Are you crazy? As soon as it drops,
100%.
I tried.
Send the link to
something is gonna come.
I tried.
Definitely.
I seriously tried, but yeah.
Even if one person watches it and says, "Oh my God, this sounds like what I went through,"
just one person,
and they feel like I'm not crazy.
Yeah.
And I knew there was something different. Yeah. I knew there was something wrong, and I'm not crazy.
Yeah.
That in itself.
Yeah.
The impact
just
is
one
crazy.
Person, so
even if just one person,
I'm looking forward to it. So
but
guys,
it's gonna be a lot of people.
Yeah,
I know.
I'm
really proud of you, Gemma. Honestly,
me too.
I'm so proud of you.
Yeah,
what do you mean? Beginning of the year, she was talking about, I want to do this, and she did it.
I love that.
Yeah.
TED Talk in September.
Spoke it into existence.
I did.
Yeah.
That one. Yeah. Yeah, I'm a real believer of speaking things into existence and making it happen. So listen, MSW, maternity support worker, you got this. You got this.
Do you know what? As well, I love giving back. Like, I don't. It's not all about money. Like, I actually love giving back. Yeah. This is my passion.
Yeah.
This is what me and Suya, inshallah, one day will be our full-time job.
Yeah.
And this is where we'll be making the
This is all we want to do. We want to live in the studio, man.
Exactly. We literally, if we could take this and take it home, we would.
Yeah.
But I like to give back. I volunteered
Yeah.
for a whole year
Yeah,
at a community
honestly.
centre,
Yeah.
and I was there two times a week
Mm.
for a whole year.
Yeah, this is me giving back. This is my midwife that I had. You know, she was here. Like, I would just be saying thank you, like, undoubtedly thank you to her, because she saved my baby as well. She saved me. I could have easily taken that doctor's advice and, you know, ended my pregnancy, and I didn't, because she said she'd be there for me and support me, and she did. She validated me, and she held my hand, literally, physically, and, you know, I don't forget her. I'm grateful to her.
Oh,
so this TED
bless.
talk is literally in memory of her, and I'm so grateful for her. So yeah.
That's so beautiful.
This is such a nice way to wrap up, guys.
So I think we're so lucky. We keep meeting amazing
Hey,
midwives.
listen, every single guest.
swear
we're
to
like,
God.
"Ugh."
We keep. Now I'm thinking,
We
if
love
I
you
ever have
guys.
another one, I'm not going to be as scared, because I'll just hit one of you lot up.
Listen.
Like,
Which one? We got midwives on our
we got a roster of
There
midwives.
you go. You got a list, innit? You got a list of us. No, but thank you guys.
Thank you for
Do you want to
coming,
plug
Gemma.
yourself? Tell people where they
Yes.
can find you.
Guys, you can find me at _Hyperemesis_midwife on Instagram, on TikTok, and on LinkedIn. I'm Jemma Martin.
I love that.
Thank you
you
for having
so
me,
much,
guys.
Gemma.
Appreciate
Thank you for
it.
coming on.
Thank you.
And for any mums out there who are currently suffering with HG,
Yeah.
I hope this episode at least brought some comfort and that you felt heard and seen.
Yeah.
And if you have any worries or concerns, I'm sure you can just follow Gemma's Instagram, ask any
Please do,
questions, and she's got a lot of information on there. But you got this. All the HG sufferers, you got this.
HG
Yeah.
Warriors, we've got this.
Listen, man, you guys are soldiers, man.
Because we watched it happen in real
You've
time.
seen it with
and
Zainab.
It is.
She looked
not
lifeless, like
Mhm.
a shell of herself.
pale. Like,
Yeah, it's horrible.
we've seen it firsthand, and it is not for the weak or faint-hearted. Honestly, you lot are absolute warriors. You lot are incredible, and your children are here because you had to suffer through all of that. Thank you for watching our episode, and we hope you guys have enjoyed it. Please leave a comment. Please subscribe. Please share it to anyone. Tell your friends. Tell your mum. Tell your nan. Yeah.
Thank you, guys.
Thank you, guys.
Thank you, Gemma, once
Thank you,
again.
Gemma.
Thank you, ladies.
We hope you guys enjoyed.
We appreciate you
Take care.
guys.
Bye.